We are now live.
Good evening, everyone. It is the special board session, study session for the Santa Rosa City School Board for September 15th, 2021. And we are going to stand for the Pledge of Allegiance. And everyone gets to say it out loud, so unmute and sing it out. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. There were no reports of actions taken in closed session, and at this point, we are going to ask for any folks who have any comments on the consent items. And Beth, I'm going to let you take that over.
Okay, so if there are any members of the public attending the meeting who would like to comment on the consent items, they're the items at the end of the agenda, the E items. Please raise your hand at this time, and then we will pull that item at
To
the
talk
end of the
about it
meeting,
during
to
consent.
talk about it during consent. And so I am going to call your name if your hand is raised. And if you would please tell us which of the E items, E1 or E2. Remember, this is not to speak on the discussion item, the updates to the district COVID safety plan. This is the consent items only at the end of the meeting. And John, if you could please state your full name and which of the E items you wanted to comment on, please.
E1, John Navarro.
Thank you. Stacia Okura, could you say which item you wanted to comment on in the consent items?
E1.
Thank you. Sheila Walker, could you please state which item?
E1.
Thank you. And Mama Lisha Vetting, could you please state which item?
E1.
Thank you. And President Fong, it looks like those are the only hands that were raised for consent items.
I appreciate that comment. It's because it's a really awkward way to do it. You have to say it now and you have to wait, but it helps us with our agenda and how we move through it. So thank you for working through that with us. At this point, we are going to take public comment on the agenda items only, and that would be the updates to the COVID safety plan. And we are going to be limiting that to 2 minutes for a total of an hour. However, also, and not in the written agenda, we are going to be, after public comment, 2 minutes per person, total an hour. The board will then have questions and discussion. At the close of the board's discussion, we are going to reopen public comment because we want to hear from people again after our discussion, what else people have had, what want to say. So if you spoke once, you can't speak again. Again, for 2 minutes, but the second time around, it's going to be limited to 30 minutes. So that's 30 minutes, 2 minutes each. That's basically 15 people. If you don't get to make your comment, please email us. We read all our comments, and you can just get to us and say what you want to say that way as well. Thank you. So right now we are going to be taking public comment on agenda items. Thank you, Beth.
Members of the public would like to comment on the agenda items, the study session discussion, please raise your hand at this time. And Lisa Mott would like to comment.
Hello, Superintendent and Board. Thank you for taking my comment. Can you hear me okay? All right, thank you. I'm calling in tonight, although it is very difficult to do so. I hope that all of you realize that your constituents do feel very trepidatious about calling in and speaking to the board. It's a difficult thing to do because we support our children and their education and their teachers, and we come forward with our concerns from a place of caring and concern for our own children and the children in our community. And tonight I want to speak to you and let you know that I am opposed to any type of mandatory asymptomatic surveillance testing. I'm especially opposed to mandating testing of vaccinated students, such as my own daughter and many of her peers. At this time, if you were to check the Press Democrat, you would see that our case rate per 100,000 and our test positivity rate are both down. And you would also see that California has recently become one of 3 states to leave the CDC's high designation for COVID transmission. In addition to these things, I feel that it's very challenging for many parents who have a difficult relationship with the idea of a school mandating a test on their child to speak up, to give their concerns, and to be heard. And tonight, with the COVID safety plan, the agenda did not even speak to exactly what is being discussed. So most parents are unsure of what is even being under consideration. I implore you to at least reach out to your constituents and your stakeholders and get a much broader range of opinions from a larger range of demographics of our student body. And the last thing I'd say is that if you have to change the name from surveillance testing to screening testing because of a negative connotation, it's a good sign that you should probably rethink what you're considering doing. Thank you so much, and I look forward to hearing what you all have to say tonight.
Thank you. Next comment is Veronica Jordan.
Good evening, board. Good evening, superintendent. Catching the first couple of minutes on my way out the door. I just have a comment about allowing us to have vaccinated parent volunteers on campus. I know you're all aware that we are having some behavioral issues, not unexpected in the context of return to schools. And I understand that there's not funding to pay for more staff. At Cesar Chavez Language Academy, we have 66 fingerprinted family members, parents and grandparents who would be more than happy to assist our staff and teachers in what feels like an unsafe condition. Those are words that were spoken to me from staff and teachers during recess and lunch. So I would like you to change your COVID safety policy around allowing vaccinated parents, volunteers on campus outside for adequate supervision of our campuses until this can be sorted out in another way. Thank you very much.
Thank you. Next is Shelby Dodson.
Hello, can you hear me?
Yes.
Hi, I am a local activist in your community. I was featured in the Press Democrat as someone who is opposed to mandates. There are several reasons behind these regards, but we'll keep it short and simple. I think that being that you guys did the Pledge of Allegiance at the beginning of this, to give people their liberty to be able to exercise their rights, to do what they want with their health for the best of their children, regarding these mandates and long-term effects of these things, people don't have a very great understanding and are not well informed. I think that the fact that the testing uses products in which most people don't know create issues for people in the long run, those are things that should be looked into. And also the things that are being mandated on individuals regards to their health when they're obviously in control of their own health. I don't think that health advice should be given by any particular member of the board nor any staff when we're in regards to what they're doing for anyone's minor children or even themselves if they're not willing to take risk of liability for what they're suggesting individuals have to be doing. At this point, we've crossed a couple boundaries within some civil rights issues. Being a Black member of the community, I feel like our demographic isn't being looked into or even thought of when it comes to issues that we've faced when dealing with the government and their way of treating us through medical means. I think that there are tons of individuals who are confused as to what's being stated by the CDC and the FDA, and these individuals are not being given enough information to make informed decisions based upon the information that's being provided by the media.
Sorry, Mr. Dodson, but you have run out of your 2-minute time for public comment. Thank you for your comment. Next comment is from someone who doesn't have a name on here. If you could state your name for the record. The person with Motorola on their name, could you please state your name for the record? All right, next we're going to go to Donna Prack.
Hi, good evening. I'm just calling to voice my, or pleading with you guys to please allow vaccinated, TB tested, fingerprinted parents on campus to help. Because with our kids being out of school for 1.5 years and not being adequately staffed, our kids are suffering. Our kids are having a difficult time learning how to behave on a playground or how to interact with each other. You know, kids are hurting. And the amount of kids that are going to the health office for injuries, it's frightening. I mean, today I substituted at my kid's school at CCLA, and I broke up 4 fights with little kids playing soccer. You know, they're hurting themselves because they don't know how to behave with each other. And if the district cannot afford or to adequately fund the additional supervision that's needed on these campuses, then please amend your, MOU or COVID guidelines to allow fully vaccinated parents to help with the supervision of children, because this is a safety issue. So, thank you.
Thank you. Next is Andrea Rojas.
Good afternoon. I'm a CCLA parent. I have a huge concern about having enough staffing for school supervision at our school, or enough staffing, supervision. Parents are more than willing to volunteer, but it is the district's duty to have enough trained staff to ensure the safety of our children. Keeping our children safe should be our top priority, especially because all students have been home for the past 1.5 years. Kids are so excited to be back on campus, but they don't know how to play anymore. They once again are being taught how to share spaces, how to play with others, and most importantly, how to socialize in a safe manner. We keep hearing that the district is getting COVID funding, yet we're not even given the opportunity to hire a campus supervisor. It's not even posted on EdJoin. The only position that specifically supervises our children. I hope that keeping our children safe at school is also your top priority. Please let us hire more staff. If not, allow parents who are fingerprinted and vaccinated volunteer their time to help supervise our students. Thank you.
Thank you. And next we're going to try public comment from the name Motorola. Again, if you could please unmute and state your name for the record.
Yeah, this is Gerald Stahl. I don't think most parents realize that you guys are not really allowed to be testing with the surveillance testing, and that they can call in and put their children's name on the list with the principal. And you guys should probably, as a board, put some of that information out so the public knows that, because a lot of people don't. So I just want to make sure everybody in here is a parent knows that information because it's a lack from your guys' end to provide us with it. So that's it.
Thank you. Next is Mama Alicia Betting.
Hi, my name is Deanna Oliveris.
Thank you very much, Deanna.
I speak sometimes on your guys' board meetings, and I'm generally frustrated. I don't know any of you personally, but I live in the Rincon Valley area, and I have 4 kids that went through Rincon Valley and Santa Rosa School District still attending. And I'm just disheartened by Santa Rosa City School District in general, now that my kids are in junior high and high school. I used to be PTA, everything. I've done everything. I volunteered. I was a ESL assistant with Rincon Valley. I was an office manager. I was from kindergarten to 6th grade. I've done bond measures. I've supported teachers union. And it's pretty bad when you are pushing parents like myself that have dedicated their life to service in the public education and employment to feel like I want to pull my kids out of school, your school, public school, and take on another job to send them somewhere where they listen, the administrative listens to us. You don't ask us, you ask the teachers union, the classified union. You guys go behind closed doors and bargain and figure out what is best for our kids, and it's disgusting and it needs to stop. And we are entitled to an opinion. We have the right, you should be asking us what you want our kids to do on a daily basis. And you should be asking parents we want volunteers on campus, and you should be asking parents, all parents, every single one of them, no matter what color, no matter what school, no matter what age. And I haven't seen that at all. And parents are going to start lining up and aligning together, and they're going to pull their kid if you don't make our kids your priority.
Thank you. Next is Julie Drogan.
Hi, good evening, board. Thank you very much for taking my comment this evening. I am a middle school teacher as well as a parent of a 3rd grader at Cesar Chavez Language Academy. I've been in school districts in Chicago Public Schools, Boston Public Schools, Petaluma, Roanoke Park, and Santa Rosa. I am extremely concerned and quite frankly, a bit outraged to see how Cesar Chavez Language Academy is being set up for failure upon reopening this school year. In the spring of 2019, the board was very clear with all of the community at how precious Cesar Chavez Language Academy is to the community of Roseland, to the southwest side of Santa Rosa, and to the city of Santa Rosa in general. We were told how important the school was, how much the board believes in the school. Diane Kitamura at the time said how important the school was to us and that it was in everybody's #1 priority for the school to succeed. We have opened this year after a year and a half of not being in school. This is the first official year of being merged with Cook Middle School. We've opened with 1 principal, 1 assistant principal, even though a school like Comstock Middle School, which has 412 students, has 1 principal and 1 assistant principal. We do not have restorative specialists on campus. We do not have enough supervision. We do not have enough. We have vacant teacher positions that have not been filled yet. And I'm being told over and over again that there are unprecedented COVID relief funds meant to be spent to help students reacclimate to coming back to school and benefit their social and emotional needs. There are many, many families who have no choice to take their kids out of Santa Rosa City schools. And there are many, many families who chose CCLA because we believe in the mission of CCLA. Si se puede. Thank you so much.
Thank you. Next is Sheila Walker.
Good evening, board, Superintendent Trinnell and President Fong. I'd just like to add that I'm actually at a volunteer spot right now, but I believe that the district received $60 million. Not sure if that's correct, but just in my head, of COVID relief funding. And my understanding was that parents would be participating. And by that, my understanding was that we would be giving our feedback on what we felt was needed for our students and the children and their learning loss. I know at the last board meeting, there were a couple of you that believe that there has been no learning loss. But I would be happy to share with you my experience with my son as a 7th grader last year, who lost a year plus and is now struggling with mental health issues because of school closures. So yeah, there is money available. And for any of the parents listening, there was a budget that was approved. You can find that online where the board posts, and you'll see the comments at the end that I had actually made myself about where's the budget going. And I know a lot of the COVID funding, for the parents that might not know, was spent on salaries and benefits. And I know some of it cannot be spent that way. And that's why we as parents need to be given a seat at the table regarding our children and our tax dollars and what is happening with the education of our kids. Thank you.
Thank you. Next is Stacia Okura.
Oh, sorry, I was muted. Good evening, Superintendent Trinnell and School Board. I'm here to really follow up on the request for parent volunteers to be allowed on campus. And really there is already precedent set for that, because last year when vaccines were not commonly available for adults, parents were allowed to go into classrooms and supervise non-instructional cohorts. So that was allowed last year, unvaccinated parents in classrooms with students. And so if that was allowed last year, it really should be allowed this year. And, we really need to just get in there and help the students. So please, I'm just asking you to please allow that to happen again. I also wanted to request that you really prioritize symptomatic testing. There's a whole lot of talk of asymptomatic testing that I hear, and frankly, I really have not heard a good case for why asymptomatic testing needs to happen and is so critical. And I really am asking the board and the district to put out information as to why you think that should be, the highest priority, why that's the testing that that you have implemented first. When right now our children are getting kept out of school because of symptomatic testing that's lacking in the community. One thing that I have heard that Marin County is doing, and that I would really ask you to look into, is starting a rapid testing program. They're actually sending kids home with rapid tests and allowing parents to apply the rapid test to their own kids and send in their results. And they are accepting that as proof to let the kids back into school. Within one day, they can get the kids back in school. So can you please look into that and consider that? Thank you.
Thank you. Next is Janelle. Janelle, would you please state your full name for the record?
Hi, my name is Janelle Payne, and I'm a teacher at Montgomery and a parent of a 2nd grader. And I hope the board is hearing tonight something that teachers and your staff have been saying for several years, maybe more. We have to pay CSEA more. We have to. There's no way we are going to be able to recruit campus supervision or attendance office personnel or family engagement coordinators when people can go to in and out and make $18 an hour, maybe get some benefits with that, and we're only offering them 15 and change. And maybe we're not even offering that yet. There's just no way we're going to get people in those positions, even if you put the money in that pot. We have to raise the wages of CSEA. And we're hearing that loudly and clearly from parents at CCLA tonight, that there's not supervision on campus. But let's be honest, there's not enough supervision at any of our school sites. We are all suffering district-wide. We're suffering statewide, and we're suffering nationally if we get real honest about it. And more money isn't necessarily going to attract the people unless we're raising the specific wages of those positions. So please get real about paying people a living wage in Sonoma County. Also, while you're at it, put more money at the subs because we're not able to attract subs either. And when our principals are full-time teachers, they cannot also be principals. So please, let's get real about what we're paying the people that are staffing our schools and taking care of our children. Thank you.
Thank you. Next is Jenny Collins.
Yeah, hi. My name is Jenny Collins, and I have a middle schooler, and then I also have elementary school kids coming up. I just want to say thank you all for hearing all the parents tonight. I'm frankly quite shocked how the parents have been left out of pretty much every conversation that has been going on lately with everything that has to do with COVID and returning to schools. I know that many parents are very, very, very passionate about it, and sometimes can be overwhelming to hear from parents in such a frustrated state. But I think that that's also an indication that, you know, things need to change. You guys need to listen to us. You know, these are our kids, you know, and they're just super suffering right now. And it's very disheartening that y'all aren't listening to us. And anyway, I just wanted to voice my opinion because it's very, very frustrating sitting on the other end, not knowing what's going to happen, you know, especially dropping your kids off every day and hearing all of these stories about how money's supposed to be used and how, you know, the kids are supposed to be in class, but, you know, all these random testing and sorry, I'm going on right now, but anyway, please just do some surveys, take us into account, stop closing the doors. We're here to help. We want to get, you know, everything back on track. It would be great if Sonoma County, you know, could be a leader in all of this, you know, instead of, you know, bowing to, you know, certain associations and money and things of that nature. You know, let's do this for the kids. Thank you.
Thank you. And President Fong, everyone who had their hand raised has had the opportunity to comment.
Thank you for everyone who took the time to give us information and how unhappy you are and specific concerns. Please know that we listen to all of it. We also know that in terms of giving feedback to the board, that people write to us all the time. You are welcome to write to us. We read it and we work to respond. So we keep listening. All right, we are moving on to the item of the night, the updates to our district's COVID-19 safety plan, and Superintendent Trinnell.
Thank you, Board President Fong, members of the board, and our families and community and staff. We bring before you tonight information for your consideration during this study session. So I want to be sure that our guests know that tonight the board is not being asked to take action. We are asking the board to discuss and consider a variety of mitigation measures around COVID. I welcome Steve Mazzara, our Executive Director of Special Services. Steve, if you could change your name on your screen, that would be great. We're all sharing Rick's links, so thanks for doing that. And we also have a variety of health professionals that I will work with Adina to bring over as well. We want to demonstrate that we are working and listening in a variety of ways, and I want to recognize the voice of our families. We are considering additional ways that we are going to get your direct input, and so we will be looking forward to following up with you on that. And with that, tonight we have a PowerPoint presentation that Steve, would you like to share your screen as you go through it? Okay. So I'm going to turn it over to Steve now, but I want everyone to know that we will be talking about testing, vaccinations, masking requirements, and I believe we still plan to discuss athletic and extracurricular guidelines as well. And again, weighing in for the board's consideration. And Steve, I will hand it over to you.
you very much. I will try to do this. I got to minimize something. Here we go. So, hi everybody. We're going to just be kind of outlining some ideas and some think abouts for you to consider, board. When we come back, I will have moments where we can stop under certain topics. Like as an example, we'll talk about staff vaccinations or staff testing, and we'll take a pause and we'll take questions and feedback at little moments along. So we're not going to have a lot of talk at you, and then we'll have moments for feedback and interaction. At that point, I think Superintendent Turnell, it'd be nice to have members of your panelists available so the board can ask questions, because I certainly am just a messenger in most of this case here. So tonight, of course it happens like this, forgive me. Tonight, what we're going to kind of go through is we're going to provide the board guidance to allow some direction in the following areas of practices and procedures around student and staff COVID-19 testing, student and staff COVID-19 vaccinations. We'll also discuss masking requirements due to COVID-19, and then a couple pieces about athletics and extracurricular we want to make us aware of, and provide some information to if that's also something of the board's concerns. We're going to start with just some authority. I'm just have this. I'm not going to go into the details of each link. You board members are more than well aware of them, but just what we're talking about here is the California Department of Public Health has broad oversight into this matter, as we already know. They have given us information about back to school work. I'll talk about those in our testing, some testing protocols and testing guidelines. Recently, though, one of the issues for tonight, I talk about the vaccination order for workers. There's been some updates to that you're probably well aware of. I'll integrate that in. And then in our own Sonoma County version, they've augmented the August 11th vaccination order, which had an order for workers at school districts to have vaccinations or be tested weekly. And the original date was October 15th. Our own Sonoma County order listed there, C19-27, moved that timeline up to December 24th. And so those are, as an example of some of the authority and some of the need to really make some informed decisions soon, because that implementation will happen for us the Monday we come back on the 27th. So the first place we'd like to, please.
Just a quick question on that last slide. You said December 24th. Did you mean
No,
September?
September 24th.
Okay, just want to clarify. Okay, thank you.
Bet. So I'm going to start with a little bit of the student testing framework that was outlined over the summer by California Department of Health. There are a couple of layers to it, and there's some options and frameworks that they have provided to schools. Kind of walk through that a little bit so we can kind of see where we are in the cycle. Where the state wants us to move, and then we can kind of talk about, obviously, discussion points where your board you'd like to move. So taking that back, what happened, this is some basic CDC guideline. You guys remember, we are not strictly using the tiered colored system that the governor had done in the previous plan, but I use this because this language is integrated in the state testing guidelines coming up. And the two metrics that they're looking at is the cases per 100,000, and then the percentage of positives, that percentage of transmission. And so as that was actually already mentioned in one of the comments, and I'll come back to that. I have some information around that. So this is the framework of what we're looking at, because depending on where we are in this zone, these zones, the state is kind of having us look at what our testing procedures would be based on that. So what was given to us in guidelines are the idea in these four basic areas: preventing COVID, or keep track of COVID-19 outbreaks, preventing outbreaks, responding to school outbreaks, and keeping kids in school. Those are the overall categories that we're providing some guidance on. And as you can see in the top up here, let me see if this little laser thing is going to work for me. In this area here, you see that under the idea of we should be tracking to keep COVID-19, keep track of things, when we have cases of low community rates, no active community outbreaks, This is something that they're guiding us to say we can consider what we should do and what level. You'll see in a minute of what testing. When we have cases of a more moderate, substantial, or high community rates, and we have active community outbreaks, they do talk about having a different level of testing requirements. Similarly, in responding to school outbreaks or working on keeping kids in schools, there are different activities that you'll see here in a minute that they're promoting that we participate in. So where are we in the data before we try to match where we are? I took this from Sunday's county website, but actually in today's paper, as you all know, things are changing all the time. This rate right here was reported today in the Press Democrat as 15 per 1,000. And the positivity rate, I don't know if that's been updated. And if it is, perhaps some public health can help me through that, of a rate of 3.2. So what that means is that we apply it to this metric. We were in the yellow as 15, but our positivity rate was over in the blue of less than 5. And the guidance is if you were in one of the areas, you take the higher area. So what we take from that is in their framework, we would be considering where we are right now in the county in the moderate area. Okay, so what that means for us is in these various areas, we would look at what would we do for testing and what is the recommendation. And so in the moderate area, I'll just walk through. If we are in the area of keeping track of COVID, they talked about having pooled PCR tests. They would want us to test at least 10% of our population. And they talked about every couple of weeks here, or at entry, pre-entry of before school began, or when we have outbreaks. So if we were in that range, that's what the state is kind of recommending for us. In the area of preventing new outbreaks, they talk about pooled PCR testing in elementary schools. And of course, elementary is saying this guidance because our less than 12-year-olds have not had access to the vaccination. They also suggest in this guidance that all unvaccinated students would be tested weekly or twice weekly. That's the framework that they're giving us in this. And then in responding to school outbreaks, if that's where we were, we would be talking about PCR-based, potentially some rapid molecular tests. We would want to test all exposed students or unvaccinated, regardless of their status. And now those are cases where somebody might have been in close contact, as we designate through our contact tracing. And the frequency of this is they would just want us when we had exposures at the beginning of a quarantine period, as you already are hearing from families. And as you may know, if someone is presenting symptoms, the recommendation from public health is that they go out for 10 days of quarantine and they may return to school if they test negative with a PCR test after 3 to 4 days, and they no longer have any symptoms. And so what this responding to school outbreaks is they would want us to try to find a way to get anyone that was exposed quicker. And that's similar here to the symptomatic people, the modified quarantine. So as board, I think, as you know, and you've heard before, students are going home with symptoms if they come to school. They are being sent home. We are trying to get them into the system, the structures, so we can test symptomatic students in a way so they can return back to school. We are doing modified quarantine procedures where we do have technicians coming out to school sites and testing students that are not symptomatic if they've been potentially exposed. And that's what this is. And that's exactly what we're actually doing.
Steve, we have a question, I think, right now.
Sure.
Yeah.
I may have to go back on a screen. Hold on there, everybody. Go ahead. Someone has a question. I can't see everybody.
You're on mute.
We can't hear you.
Trustee De La Cruz.
We still can't hear you. So.
Yeah, still can't hear you.
Ed, go ahead. Do you have a question?
Sure, I'll just go ahead. I just, when you would use the term outbreak in number of students, what are we talking about? How do we define?
That definition of outbreak was pretty tight in the spring and the return to school guidance. Yeah. It is not as we're trying to get a definition of that. What we are doing is consulting with public health. Public health has given us guidance when we have that. We've had one school where we did have a couple of outbreaks in one classroom, and it was not deemed yet, given the situation, that we had a considered quote outbreak.
Okay.
So it's what I'm saying is that it is not as clearly defined as it was in the spring. That's probably giving more guidance or flexibility to schools to work with public health to look at the individual situations. But that could be a greater question for those of public health later tonight.
Absolutely. Thank you.
Allegria?
Hopefully my sound is back, yes? Okay.
Yes.
My question, Dr. Mazzara, I know for those of us who are in this day in and day out, a lot of these terms are like, we're pretty fluent with them, but I would love it if you could just kind of go back and talk about what pooled testing is, what a kind of PCR test is versus the kind of test that you can buy, you know, at Walgreens, and how we break some of those options down for folks in our community to understand what those different options actually kind of look like in the real world.
I plan to do that if you don't mind. Well, when I talk about the actually logistics of what the tests look
Great.
like, I'll walk through some of those so families can get a real understanding what it would actually look like. Great.
Okay, thank you. Steve?
Back to sure. So we posted last board meeting. I reworked the graphic for the board's request. So this is kind of what we've been seeing, that we had some spikes, but in the last week, and knock on laminate over here, we have had in the last 2 weeks, we have had a lower amount of cases come at us in our school settings than we did at the beginning of school. So all else being equal, I have to say where we are feels very good right now. So moving and talking about the discussion, I'll talk about staff vaccinations and testing first. So getting back to the basis of the order, these are some of the language taken from the order, that it requires unvaccinated or incompletely vaccinated workers, of course, that's say 1 dose and not 2, depending on the dose they're taking, to undergo the weekly screening. That's in point B. C just talks about they're exempted from some of it, but not exempted for certain conditions. So they don't have a right to exempt except there's a medical, but they could still be spreading it. So there's kind of a waiver, a very tight waiver on workers that have a medical exemption off of it. And then, there we go, back up, sorry. Then the last one is, we're talking about diagnostic screening. We have to have a place for tracking and contact tracing. Those are all the elements of the public order that we're working with. And of course, as mentioned, this was the order effective for October 15th in this county. It is effective for September 24th. So what we are planning to do is
Director Mazzara, I have a quick question.
Yes.
Sorry to interrupt you.
Oh, no.
I appreciate you're going through this efficiently and effectively, but on that last slide, just to clarify, just to get our vocab dialed here, on A, where it says required to undergo diagnostic screening testing, do you mean testing, like PCR testing?
Yes. Yes.
Okay.
That's
because when I see diagnostic screening, I see the word screening, I think of like those 4 to 6 questions you have to answer before you walk in places, or whatever. So okay, so we are talking about unvaccinated or incompletely vaccinated workers are required to undergo testing, PCR testing, at least once a week.
Absolutely.
Okay, thank you.
That's it, exactly. Good, thank you for clarifying. So what we're looking at, what we're planning for right now is we currently do have a vendor, the vendor Color. Color is actually just one of the state vendors. They're used district-wide in San Francisco and many others as an example. So that's the vendor, and they provide for us vials, the swabs, the barcodes. So there's a whole system that staff that have been going through voluntarily with the Color system are doing on Mondays and Wednesdays now. So it's a system and a process we've been using for, we did it last year as well. We did it for volunteers. We did it for our sports teams last year as well. And then we're doing it on a voluntary basis for staff. So what we are doing is we are developing a team that is going to support this by creating let's say at one of the schools, we will have a bucket, a basket of named staff members who will get their weekly requirement on X amount, X day. And then they on their own, probably, we talked about it when we were talking through our MOUs, put it in the staff mailbox completely for the staff on their own time. Privately, as private they like to make it, they would be swabbing their own nose as staff members, putting it back in together, sealing it in the vial, and then putting it back in the container to be picked up at the end of the day. We have those containers currently. As we're doing those, they get processed every night to the color lab. We have a site at our district office where those are picked up. So we're simply kind of using the existing systems that we have to process that at the time. And so in a weekly test, I'll show you later kind of a logistics around it. Once a week, we would go to 3 or 4 schools. So it might be Tuesday for this school, this middle school, this high school, and 2 elementary schools. Their staff in the morning would get these put in their boxes. They need to return it by a certain time. We load that up. The results come to the employee, and at the employee, they get their results that show negative or positive. We on our end, we are only interested to make sure that they did it that day. If they were absent, we'd have to have a makeup procedure for them to ensure that at least sometime that week they are getting it. And so remember, as written in the current order, this is only applying to non-vaccinated staff members. So I'll show you more about that. We're using Lewis. I mentioned there in the bullet 3, we're using Lewis facility as a staging facility. We have to barcode, we have to screen these, we have to assign them to, codes, and we're kind of doing that every day. And then we will be collecting them and sorting them at the Lewis facility. Ms. McCormick, I see you there. See a hand again?
I think Director Manieri and Director De La Cruz were ahead of me, and Director Medina, and then you can come back to me.
So I can't see all hands at all times. I feel like Laura. So
I think the Director De La Cruz hand went up first.
Thank you.
Thanks. So you're so efficient, Director Mazzara. My question is actually a couple slides back on the data slide. And I just wanted to understand a little bit more, because I feel like in some ways the total number of cases can be not a reliable figure unless you also have the total number of tests that accompany it. So we're understanding kind of, the rate that what the county and the CDC allow us to see is understand that relationship between the total number of tests and the total number of cases.
Yeah.
So I'm just wondering if there's data that you can show us that kind of show, because it could be that the weekend ending September 10th, we had 0 tests, or we had, I'm trying to figure out how we're capturing this number and what this number of total tests means. And I think an additional question embedded in that is, what are the cases that we are actually required to report, or how do we get information about a positive case if it's something that's happening outside of school, or all of those questions around kind of like the data and how we're understanding what it's telling us, right?
Yeah. I'll answer, what I can, and then again, maybe for public health, they'll have more, because we're obviously on the receiving end of this from the school district side. So in answering your immediate question, we are required now, and this changed about 2.5 weeks ago, that public health wanted to see all our data, number of students that were sent home, suspected cases. We had this whole tracking document that we were sharing with public health, and that changed it a couple weeks ago, where they only had capacity, perhaps, as I've heard it, to really talk about the positive cases. So we've shifted in that, and we only report to them the actual confirmed cases. So what it looks like on our end is a student would be sent home with symptoms, from our isolation tents, or parent would call in and say they're not coming to school, they have symptoms. We'll let you know what happens when we get a test. And so then we're waiting for them to report back to us, did you get your test? Are you clear to come back? So some of that data, obviously, we're passively waiting for. So I don't know if I could accurately, getting to your point, I don't know if I could accurately get from every family how many students actually went to get a test, because we also have families that, as you have heard, and as you probably know personally, are having struggles getting appointments. And so sadly, some of them are just waiting the 10 days. And so that's another indicator, obviously, of another issue, another layer. So part of that reporting data, we have not been asked to track again from county. We're tracking details around quarantine by attendance. As much as I understand the layer of that data, right now we're not being asked by public health to really track that. And so I think that's something we could discuss.
Yeah. I had one more question kind of related to the data and the reporting. So if a child tests positive and is captured by county health data, and is county health asking if that child is a member of a district and then reporting to the district as well as reporting to the family itself?
They do, exactly. So in this change, there's been really good feedback back and forth. And so the school reports directly to public health on a separate sheet. We have a little tracking document that they put together that I get a copy to kind of track and monitor. And then literally public health is receiving that. And so there have been a number of examples where they're asking us, did you get a positive? Because public health on the other side is getting notifications from the vendors that so-and-so is tested positive. They do ask them about their school, and they kind of backtrack to find out where that is. And we've gone back and forth, each of us, hey, did you know about this? We didn't know about it, public health. They'll tell us, no, we didn't know about it. So we've been really good circling that very tightly in the last 2 weeks, and it kind of goes both ways.
Thank you,
Steve. I'm going to allow board members to ask questions. I will call on them. I can see their hands, and section by section or slide by slide,
Sure.
versus just saving it up till the very end.
Sure.
All right. So I don't know the orders. We'll start with Stephanie.
Sure. I just had a quick question, and I think it was on the slide that we ended at, or maybe the one before, about who has to be tested on a weekly. Thank you. So am I correct in also understanding that those who are who only have one vaccine also have to also fall under this health order? So if they're
Yes.
incompletely vaccinated?
That's exactly what that means. If it's a 2-dose vaccine, because obviously there's a 1 dose as well, that you have to complete both doses. And if not, you are considered in the unvaccinated or incomplete group.
Okay, thank you.
You bet.
Director Medina.
Yeah, my first question is going to be, what is the cost of each test?
Right now they're giving us a quote of $21. I have a little something later in the considerations. So if we want to move to that real quickly so you can see that. I've heard stories that the price caps are coming off. Superintendent Turnell heard something about $125 per test, unreimbursed from their medical provider. So I'm kind of unclear. My contact with them has really, they've stated it's still a $21. And so the numbers I have on the screen, just moving to that, is that currently we are receiving around a 70% return rate on our own vaccinations. It could simply be we haven't all had the numbers come in yet. And so if we cost that out, I costed out the number of tests we did if we were doing all employees under that first bullet right here. If we did all 1545 employees once a week for 13 weeks, that gets us through the middle of January. That's what our cost could be, up to $21. I didn't cost that out if it is a different rate. And then approximately if we did the mandate of the order, which is testing only unvaccinated, those are the costs associated with that as well.
And the other question is, if we mandated vaccination for staff, this is potential savings, like probably in a 13-week period. So maybe, I don't know exactly how many weeks are in the school year, but probably close to
double the $26,000
we could save. Okay.
Yeah, absolutely. That's actually one way. I know that was a conversation. I read some of that with the LA Unified decision, that by requiring vaccinations, then you're saving some of the other side on the testing. So there's certainly going to be pro and con discussions around those as well.
And maybe if this becomes something that we start looking at further, can we also look at because this is just the actual cost of the tests, right? But that's not including additional cost of staff to administer this whole testing process.
Exactly.
Can maybe that be included?
Absolutely. I estimated, again, for the 13-week period, we had a contract we took last time to develop this team at a cost not to exceed $375,000. So if we didn't have to spend that amount, there's definitely some savings out of our ESSERS money for sure. Okay.
Trustee McCormick?
First, President Fogg, I have a question. So I like this format as we're kind of going back and forth live time, but are we supposed to just do questions right now? Not discussion, right?
We are taking questions.
Okay, great. Okay, because I have a comment, but I'm going to save it. I want two questions. One is, we talked about the required testing for staff members if you're unvaccinated or not fully vaccinated yet. And you said that there is an assigned day when they self-administer the test and then submit it by the end of the day. And then my question was going to be, and you started to address it, but I want some more specifics, was what happens if someone misses the testing? So you said there's a makeup procedure. And so I'm just wondering, what is the makeup procedure and how, what's the grace period on that? Because as you know, it takes a while to get PCR tests back. And if you miss, you're out of cycle and you miss your day that week and you back up a couple days, that could be an extended period of time, like a week to 2 weeks, where someone could test positive and we don't know that yet. And they're still in the, working on campus.
Yeah.
And so I'm just wondering, what are the specifics? Because inevitably someone's going to miss a test, things happen. And I just want to know what the makeup requirement is. And so that we're very specific about that, because you need to know once it pushes it back, it pushes it way back and you're out of cycle for the week.
Right. No, so let's say, and we're designing this, there's no rule around this. Okay. This is us for logistics. If we have a Tuesday, if it's your cycle on Tuesday and you miss one day, the process we're going to have is we're going to have tubes available that right when you come back, you can go through that and we'll come back and pick those up. Right. So if you miss one day, that next day you would be expected to be tested. If you're gone the rest of the week for some reason and you come back on Monday, if your regular cycle is going to be by Tuesday, we may not have you do a Monday test and turn around and do a Tuesday test as well. Right. So we're kind of dividing what that is, and we're playing around with in consultation with color, something within 3 days. If it's greater than 3 days, we may just wait for the next cycle, because then it's, structurally, it's only about a 3-day wait. But if you miss it within 3 days, so if you're on a Friday, you miss it, we'll come back to you by Wednesday of the next date. And then you'd come back on a Friday, get back on your Friday cycle.
So would that require, so are you going around and picking up tests at every site every day? No,
we would have to do a separate standalone who needs a makeup and come around on those days.
Okay, so I know we're just, I'm crossing over into discussion, so I'm trying to be good about this, but I guess I'll wait because I have a major concern about that. Okay. So I'll wait till discussion on that. So thank you for your answer to that. And then, go ahead.
Okay, logistically, it's going to be similar to students, right? To say if we talk, we can go to that part of the slide, and those similar logistics to students being out and absent and making those up too, for sure.
Okay. And then my next question is, when there is an exposure or symptoms of students, is the student and the family of that student, are they required to go get tested on their own before they're allowed back? And or the other option is that they stay out for 10 days or until symptoms go away? We don't provide testing for our students, symptomatic testing?
We currently don't. Superintendent Turnell, we can talk later. We are meeting with people, and that could be part of our discussion at the end of this. We are trying to get those resources, and we had some very productive phone calls. So that's something we're working towards. Currently, we do not have staff that'll do symptomatic testing. And that's kind of what our hurdle is. So right now, back to your question, the family does not have to, family doesn't have symptoms, that's on them. Our student, the current regulations is they're not allowed to come back to campus right? Until they have a negative test, and their symptoms have been removed for over 24 hours.
Okay, but when I said the family, I mean, it is the family's responsibility to get that student tested.
It is.
If they want to come back, if they want to rule out, well, so here's my question.
Yeah.
So if they get on their own, they go get a PCR test on their own, and they get that back, let's say in 3 days, are they allowed to come back if it's negative, or do they have to stay out until symptoms are gone? Like no sore throat, no runny nose, no nothing.
Actually, both. So they have to have a negative test and no symptoms to return. Negative
Okay.
PCR is what the threshold that public health will tell you. That's what they want to see as a return to campus.
But as of now, the burden is on our student and the student's family to get that PCR test on their own.
Yes, it is.
Okay, thank you.
Okay, we're going to take a break, and I know that Clerk Forrest has his hand up, has been waiting, so we're going to take a break because number one, we need to do an interpreter switch. And then since we've kind of changed the way we're doing this, where we're asking questions per section, I think, we are also going to stop and bring in other panelists who, that Superintendent Trunell spoke about earlier. So they might be here to help answer questions as well. So let's take just a 3-minute changeover.
Thank you. And thank you, Board President Fong. And as we bring our guests over, I wondered if we could do quick introductions just so that we know, you know, and the public knows who's joining us.
Absolutely.
Hi, Seth.
And Steve will give you a chance to catch your breath.
Yeah, it's okay. I honestly, after we do this, there's one more little slide consideration I'd love to share so board members can see everything, and then we can roll.
Adina, if you can let me know when you believe you've finished bringing folks over.
Thank you, Superintendent Trunell. I brought over everyone. I did not see Miss Holden present.
Okay. Is Dr. Mace here? If you can raise your hand.
Yes. Would you like her brought over as well?
Yes.
Everyone should now be brought over.
I don't see Dr. Kamura.
Can you resend that to her? She said she didn't click on it fast enough.
Thank you.
I just brought her over.
Thank you very much. Okay, I'd like to just welcome the guests tonight. As we're doing this work behind the scenes, we are working towards continuing to build partners so that we can understand all of the ways that we can communicate and how we're navigating this seemingly still new world of how we're doing school. And I'd like to start with recognizing Seth Eckstein. If you could just introduce yourself.
Sure. Good evening, everyone. My name is Seth Eckstein. I'm an attorney with Fagan Freeman Fullfrost. It's a pleasure to be here.
Welcome, Seth. I'd like to then go to Dr. Mace. If you could please introduce yourself, and we're happy to have you tonight.
Hello, I'm just having a little trouble unmuting here. Just a second. Hi, everybody. Can you hear me?
Yes.
I'm Dr. Mace, a health officer. Happy to be here. Thank you so much.
Thank you. I'd like to go to Dr. Lobato next.
Hello, I'm Mark Lobato, and I'm the medical consultant for the COVID section of the county health department.
Thank you. May I go to Adam Radke, please?
Yes, Deputy County Counsel Adam Radke, and I work closely with advising public health on legal matters.
Welcome to both of you. Dr. Kimura.
Hi, my name is Leslie Kimura. I am the COVID section Deputy Health Officer. Thank you for having us.
Thank you. Jenny Straight.
Hi, I'm Jenny Straight. I'm a nurse that works on the school's childcare and youth team for public health.
And Maya Misakian.
Hi there. I'm so sorry. I've had my camera on all day and for some reason it's not turning on now. I'd love to have you see my face. I'm happy to see all of yours. My name's Maya Misaki and I'm the supervising public health nurse for the COVID unit.
Welcome. Thank you. Is there anyone that I've missed? Okay, wonderful. Happy to have you here tonight. And I'll turn it back over to you, Dr. Fong, President Fong.
Sure. Not only we're happy to have you, we are grateful and appreciative for our visitors and panelists as well. So thank you. Let's see, Clerk Flores, you are next up for questions.
Thank you, President Fong. Director Ms. Zora, thank you. So far, this is very informative, and I like the fact that we're going, step by step. Did you mention that there's no data yet regarding the 10-day waiting period in this report, and we're going to have that information as to how many kids have been out of school?
Yeah, once we start collecting the attendance data marked as quarantine, then we will kind of have that. We're collecting that, and we generally can run those. What I hope to do is maybe apply that like Director Medina was looking at, try to add it to another metric that we look at, how many kids are out. So we're kind of just organizing that and building those reports. So I hope that's something we periodically bring to meetings. So it's another layer that we can put to it.
Okay, I mean, that's it. And the next is just a comment. Thank you.
And Trustee Medina, did you have another question?
Yeah, I did. So in the testing, I believe, Steve, you said that when employees do the testing, the results go to them. I was just curious, do we get any sort of information like, X people tested negative, X number of people tested positive, or it's just the fact that they did the testing?
Not currently. There may be a way, because I've seen that data from San Francisco on their website. There may be a way through the vendor that we can kind of keep track of that in some way. Right now, just the results are going to public health through the vendor when there's a positive. So that may be a way that we could get more, reasonable data, like how many people went through the system, what the percentages are that you're looking for. So I have to contact the vendor. That's not currently how we're set up.
Okay, thank you.
Director De La Cruz.
Thank you. My question follows up on Director McCormick. I always want to call her Director Jill. It's questions around kind of what happens when folks miss their testing times, and recognizing that, yes, sometimes it's because life is happening and you can't make that test. But I'm curious about, what happens and what the consequences are in terms of, folks who are purposefully missing it, and if there will be disciplinary consequences, and what that process looks like, and if it follows kind of a typical discipline process that the district already has in place, or if there is some kind of ramped up version of that discipline process given the severity of what's happening in our community right now.
I think that obviously that's a discussion point. I don't recall, and Assistant Superintendent Shepherd, you can, if you've had a separate conversation that you're aware of how we would enforce that. It hasn't come up that I'm aware of, but there are conversations around students, progressive levels for students. And I think, something similar would be appropriate for staff if there is that situation like anything, but I don't know, Mr. Shepherd, what else would I add to that?
Well, I'd like to state that staff are being very cooperative and eager to participate. And should we have an unusual circumstance of someone not willing to participate, that will be a conversation that we'll have. And I'm not anticipating that to happen, but should it happen, we will have that conversation and find out what the barriers are.
Thanks. So I guess let me ask this question in a slightly different way. We have mechanisms in place to allow for enforceability of these guidelines.
The mechanism we'd start with is data tracking, yes. And we'll have to develop a system to report if there's staff members that are coming to campus and not participating in the testing. So we haven't written that and had that conversation specifically yet. I think my role would be to report that data to the HR that so-and-so has missed. We would be like we do with anything. We would assume positive intent. We would try to work in a restorative way to understand, like Mr. Shepherd said, what are the hurdles, what are the barriers? Employees will have rights, and we can speak to that later about certain rights to leave, certain rights to something. We know there will be some impact that some employees will have. Hopefully it won't be in a passive aggressive manner, and we can have the conversation through HR and try to do the best we can to meet employees where they might be.
If I can add, board, because we do have board policy around how we work with our staff, we would have to review that board policy. Seth, if there's anything that you have here that you could weigh in around that, that would also be helpful.
Sure. There have been some recent case decisions from the state agency that reviews employment relations with public entities, and they've come forward to say that districts can take action with regarding to mandating vaccines and other COVID-related protocols. But if there are effects to those decisions, those would need to be bargained. And so typically something like the nature of progressive discipline that you would take would probably be something that would need to be discussed with the unions. However, it is possible to do. And many school districts throughout California have some sort of progressive discipline track for folks who are not taking being responsible in the testing. And it's just a matter of, I think someone earlier had mentioned the idea of how quick is that progressive discipline? And that's where different districts take different tacks. Some do it more aggressively and some do it where you have, a buildup. And I think Steve earlier was referencing that for students and similar for staff.
Thank you.
Thank you. I really appreciate that, Mr. Eckstein. And I guess my question would be, even if this isn't related to kind of COVID-related protocol, I'm assuming that we would use the progressive disciplinary processes in place for any violation of kind of rules and regulations at a school campus. And so there would be enforceability mechanisms currently in place without a need for additional action.
And Seth, please chime in. My understanding would be that we would want to review those policies and make sure that, applying this situation and scenario, that those would apply appropriately.
Yeah, but specifically because these are new testing requirements, we would have to look to see if whether or not this is something that we need to negotiate those impacts with the unions. However, yes, that there would be some expectation that progressive discipline as would be applied. I think that would be a reasonable expectation.
And just to be clear, it's your understanding, Mr. Eckstein, it allows for other districts have taken kind of accelerated progressive discipline steps given the time, like the timeliness that's required in these actions with regard to people who are unsafe or creating unsafe situations for other students and staff on campus.
Yes, there's certainly other school districts that have taken a more aggressive approach.
Thank you.
Director Medina, I see your hand again. Let's have you ask one question.
Yeah, so while we're on the topic of enforcement, I'm just curious, in terms of enforcement from the state down to us, what are any potential consequences, or what would happen to the district if we weren't meeting these requirements as presented?
Seth, do you want to speak to that?
Sure. The CDPH has imposed specific consequences. I actually haven't looked at the most recent guidance on those consequences, but they do spell out that the district has an obligation. So it's not simply that we are middle people, but that the onus falls on us to demonstrate to the CDPH that we're meeting those guidelines.
Thank you.
Okay, Mr. Mazera.
Well, let me just finish with some considerations on where we were. And then again, I have a place where you could, while you have everybody here. So I kind of wanted just to throw this slide. I think that we all understand this, that the requirement that's coming from CDPH is that for unvaccinated staff members, they need to test weekly. That's pretty clear. There are local recommendations that we test all staff weekly. And I think our panel members can discuss why that is a recommendation of many medical providers and what that needs. I think we've outlined just some of the considerations, some of the options for board members as we talk about moving forward. We could talk about different layers or tiers to this of random testing, voluntary testing, required testing of vaccinated staff at work. We could talk about vaccinated staff testing on their own and just doing proof of testing, if that's an idea. And then, of course, required for all staff to be vaccinated, as we've mentioned. So just as the board considers, those are the layers, I think you all know that are options for us. So we talked about real quickly, one of the considerations board, we do anticipate and talking to our HR team, we do anticipate there will be some people that will have objection to either required vaccination or required testing potentially. And that there may be some part of the staffing population that may resign and choose not to, or perhaps apply for leave, whether or not that's a discretionary leave at that point, if not a medical leave. I think that's to be determined, but it's just something we want to consider there. And then Trustee Medina, you brought up already the cost associated, with testing for all versus testing for just the unvaccinated. And that's kind of where I was going to pause about staff, before we then click in and talk about students. And so again, another place to pause, or Superintendent Director Fong, if you wanted to take it one way.
I think we can go on.
Okay. So as we discussed, very similar student, again, the requirement is that unvaccinated students are tested weekly. There's, however, a recommendation that all students are tested weekly, vaccinated or unvaccinated. So that's kind of where we're balancing. The logistics around what that would look like is we are working with a state provided vendor. So in this case, the state is providing the kits, and they say some staff, it's pretty clear that they probably won't be able to provide enough to mandate this. And so that's why I'm backing up and trying to get additional staff. Similarly, students will be scheduled to administer a self-administration of a nasal swab once per week. I'll come back to that. We have already discussed with our associations that teachers can assist students with a nasal swabbing collection. Again, it's self-administered. We don't expect any employees to actually be holding the swab and doing that. What we discussed with our union partners is that they're simply a teacher in a classroom is, okay, students, it's time to swab. Each student takes a nasal swab. Those of us that have done it, you're circling 4 times around the each nostril, going the other side. You're taking the Q-tip, you're putting it in a vial. You're taking the vial that are pooled and you're putting them in a little container in the front of the class. And so that's kind of the mechanism, what it would look like physically in a class every day. That is considered the pool testing. So when we talk about it, it's by classroom. So Mr. Mazzara's classroom would have a pool of Q-tips that get analyzed. If nothing comes up positive in the PCR testing, nothing happens, we move forward. If something comes up positive, then the company comes back out with a rapid test and they do the separate swabbing individually for those students. And so now it's identified by student, so they can identify on site at that time who in that classroom became positive. And that student then is sent home for the regular quarantine procedures. And then you see those are the bullets I kind of put in there. And so then I promised a little bit of testing logistics. Let me see if this pops up for you. So in what we're analyzing right now, this is kind of the structure that you can see. We're trying to do on a 5-day week setting. You see that we'd be testing, 3,000 students a day. And in the same structure as we would do the staff. So if it's a Monday, if the LC Allen strand is a Monday, we would do staff and students on that time. We're kind of anticipating what we need for staffing to make that happen, to collect files, to drop off, right? And so this is just so you can frame the capacity of what we're trying to do here and how we do that at a high school. We have to choose a certain period when this happens every time, because as I said before, we have to barcode specific classrooms. So there's a nuance to doing a high school that's different than an elementary school when you have the teacher all day. But you have a quick window when you might have 4th period on a certain day, let's say. You have students coming in from the JC, coming in other places. We want to try to catch everybody. So all those logistics go behind, what we're talking about in that world. So I put that there. Oh, sorry, I got to go back to this. Then options that we're describing here. There is recommendation from our local agency, Sonoma County Health, that is talking about they would like to see screening testing weekly for all students. So that's a discussion you could have with those participants. Again, options for consideration. The requirement is unvaccinated students by the state. That, of course, would be all elementary schools and less than 12, but it would not be at the secondary schools where we have many students that, of course, are vaccinated. Again, layers for consideration, random testing of students, voluntary testing of students. So we could be doing unvaccinated students, but then doing voluntaries of those folks that wanted to voluntary do that. See just the whole gamut. And then I want to throw in the layer of options and opting out of testing. So, I want to make you aware, board, that as I see it, there are kind of 3 options to this world. There is everyone must take it at school with no opt-out provision. You can make that as a mandate for in-person learning, obviously. There's another option that we could present where you opt out of doing it at school, but you don't opt out of doing it weekly. And so then there's a tracking mechanism that families can get involved. As an example, we're doing it after school currently at Lewis twice a week. Parents could participate in that. As long as they're keeping up with that, that could be a way that we could manage that system. And then, of course, there is the recommendation of opting in with consent. And then we've had some legal analysis just to make you aware, board, because of the age requirements and consent. I kind of want to just, there's some layers to that of who can give consent to this type of test. You'll see that there at the age levels. So a secondary student or a 13-year-old or higher, they have a different level of consent. And there's some shared levels of consent that you can see there as we go through this process. So, there's some very important things to think about when we talk about consent to a swabbing at school, nasal swabbing. So real quickly, before we turn it over for further discussions, I also just want to talk about student masking.
Can we,
Currently,
can
I
we
think,
stop here for a second,
please,
Steve?
please, sure, sure.
So we want to talk about what you just, can we go back? Yeah,
Yeah.
testing. Let's talk about testing. And we have some board member hands up, and let's start with Director Manieri.
Thank you. I have a few questions. For the slide that speaks to how the logistics of the student testing, I'm wondering what kinds of supports we're offering to both students and staff. I understand that, I'm making an assumption that because the MOU is also on tonight's agenda that our staff is okay with that, but I'm wondering what additional supports we're planning on offering them, and then in regard to the students, any socio-emotional support. I imagine that not all students will be able to self-administer a test, and so I'm wondering what we're going to do about that.
So on the latter question, we've discussed with our school nurse team and there are videos that the companies put together to try to help that. Like any lesson, many of our educators are ready to break that down into small steps and kind of work through that process. I've been witnessing families coming in at Lewis right now in the last 2 weeks on how they do that. And, there's kind of an I do, we do, you do kind of mentality to work through that. There's modeling, there's practicing. We anticipate that we would be doing lessons around that. As you can imagine, parents can practice with Q-tips. You can get through the sensory things that are around that, right? Kind of go through that. So we anticipate that we'd have to do that. We're going to do everything we can to minimize impact into classrooms. And we hope to build those kind of things and have our school nurses be available for families and talk about that. But in getting to the MOU, I know Assistant Superintendent Shepard, please feel, you and I have been at many of those meetings. I think they've been positive. They've been very encouraging. And how else would you categorize that?
I would say staff have been very amenable to assisting with the process, and some staff may even be comfortable in assisting younger students as needed. Although that's not a requirement, we've heard resoundingly that staff are in support of this and will assist in the ways they can.
Thank you. And just for clarification also, so we're talking about plans to do surveillance or asymptomatic testing of students, but it's also placed in this presentation as an option for consideration for the board. So I would just like some clarity as to are we actually considering that as an option, or is this something that we're already saying we're going to do? And if so, I would also like to hear from our panelists here, our guests from the Department of Health Services, if they can speak to the recommendation that was provided for this kind of testing. Yeah, just because we've definitely heard, we've had some questions, right, about why we're doing this kind of testing.
Before I turn it over and Superintendent Chernell, please call on, that's kind of where I was showing the rates of transfer, where we are in the system, what public health is recommending based on what they're seeing in the community. As you know, last spring, there was a whole color system and there was a whole thing built in, when it gets to this level, then we can take off a layer of what we're doing. I haven't heard that per se, but I'm kind of framing that it feels like there's layering to what we could do, how frequently we test, who we're testing. Those are all seem to be pretty options. I think boards have been giving a lot of authority in some of this area. And so I think that's great to make sure we understand what's the requirement and then what are our options. So I'd love to turn that over.
Thank you, Mr. Mazzara. And I wondered if Dr. Mace or a member of her team could talk about why asymptomatic testing is a recommendation.
This is Dr. Lovato. Well, asymptomatic persons actually represent, especially in children, up to 50% or more of the cases. So if we're only focusing on symptomatic persons, then we're going to miss half the cases.
Thank you, Dr. Lobato.
Okay. So I mean, just to be clear for anyone also listening, it's to catch cases, essentially.
Correct.
Yeah, testing, exactly. Testing is to find who's positive. You know, if you're symptomatic, you're going to be you get to stay home, or if you're in school, you get to return home and then get tested. So the real worrisome is the people who don't have symptoms. So that's why we have the weekly testing.
And can you speak to Dr. Lovato? I hope I'm saying your last name correctly. Can you also speak to, I think the argument could probably be made that it's not important to test asymptomatic people, even if they are positive. So can you speak to that a little bit?
Sure. There's been at least one study I saw, the estimate of transmission from asymptomatic persons is 75% as effective as from symptomatic persons. Now with Delta, I haven't seen any study, but we do know that they have viral loads, even vaccinated persons, as high as unvaccinated. So if you're infected, you have a lot of virus, and you know, again, you have a potential for transmission. So I think with Delta, you know, everything that we said prior during the pandemic, we need to reinforce and even make stronger.
Thank you. And then my last question for now, I'd like to know how feasible, and so maybe I'm referring to funds, but how feasible it is to consider more than one option. For example, could we consider both random testing and then also rapid symptomatic testing, or are we looking at just one of these options? So I'm asking about the feasibility of considering several options, or at least more than one.
Well, for the students, certainly. I mean, for the staff, you have a mandated PCR test, but I would say whatever fits your population preferences and your resources and the number of cases in that community. So you definitely could have, in some schools, one strategy, in other schools. But of course, you know, the more approaches you have, the more complex it becomes.
Sure.
But you can customize your testing for individual schools.
I appreciate that, and wasn't even actually thinking about that. My question was more toward staff and just our resources and ability to do more than one, but I appreciate that perspective.
I'm going to call on Clerk Flores right now for questions.
Thank you. So in terms of, slide number 19 in testing logistics for students, what is the turnaround time for the pool testing? Is it also 2 to 3 days, or is it different than the adults?
The vendor is telling me it's 2 to 3 days. Currently, Color Lab is 3 to 4, and even sometimes they've come back in 5. They expect, as they described it to me, they're coming around back in about 2 days. So if I came in on Monday, a positive, I'd be back in on Wednesday. And Wednesday, I'd be doing the rapid test that the company would be doing, and we'd identify that student on Wednesday.
Right. So the most they'll be out. I mean, so if a kid was, or there was a positive test in that classroom, there's a possibility of exposure for about 3 to 4 days, right?
There is. It sounds like this.
All right. And then in terms of the weekly, not the weekly, the parent consent, if we go with the required to be taken as school option without the, the ability to opt out, how does that affect our age, below 13 in terms of having parental consent? If parents don't actually consent to that, and we're requiring, weekly testings or or requiring kids to get tested. So how do we handle that sections if we go with that option that we are requiring students to be tested every year, every week, and yet we have parents that don't, consent to that?
Yeah, just from a programmatic side, we are concerned that parents will leave us, perhaps inundate our AB 130 independent study program, and create issues there. But Mr. Eckstein, I think you could talk about what the logistics of what that looks like when parents come forward against that.
Yeah, and it's a great question because frankly, the answer is I don't think a lot of people know how that would play out. I think that one of the questions is frankly around the legality of the ability to enforce that.
Right.
And even if you have something on the books, how do you actually, what's the action that you take if someone doesn't want to comply? Do you exclude the student from school? Do you take some sort of action as a stay away? Do you, it's very difficult to determine exactly how to handle that situation. And I don't know if there's frankly is a clear answer that any school district has figured that out.
Okay, that's really helpful. Thank you. Thank you.
Vice President McCormick.
Not to be repetitive, but I had the same question about what are we going to have in place as far as education of self-administered testing goes, both for our faculty and staff and especially our students. So I just have a real concern about that. If someone like me who's been tested every week and been doing this for months and months and months, it gets really easy and it's not that big a deal. But if you're a young youth and you haven't had to do this yet and you're starting to do it regularly and you're doing it around other people, it's gonna be a lot. So I just want to make sure we've got some education in place on that. So that was definitely a question I had. So thank you, Director Manieri, for asking it. And then I don't want to get us too off, but a question that I have, and I don't necessarily need a hard answer right now, but I feel like it's something that needs to be considered when we're putting together this plan, when we're really getting down to brass tacks about testing, is we already obviously have some concerns and questions about what happens when staff, faculty, or students miss a test and how do we proceed from there. But my question is, when they take a test and it comes back, because it is self-administered, and this has happened to me a lot at my work, not me personally, but in the groups that I've been tested with and that I'm responsible for, what are we going to do with inconclusive test results? Because those also come back. And so you wait 3 or 4 days for these PCR tests to come back, and then you get an inconclusive test, which doesn't tell you positive or negative. It tells you that the test didn't work for whatever reason. Either they didn't get a good enough sample or something went wrong at the lab or whatever. So then what? Right? So that's a question that I have, and you don't have to answer it right now, but I think it's something we need to consider, because it's kind of like you've missed a test. Basically, it's not intentional, but you don't have test results in that situation. So what are we going to do there? Because it definitely does happen, and I've seen it happen being in months of weekly self-administered PCR testing, and it happens a lot. So yeah.
So I think we're just going to keep that in mind as we move forward as a consideration. Thank you, Jill. I'm going to move on to Director Medina.
Thank you. So my question is around, so I think we're looking at screening, testing weekly for all students. And if I were a student and I were vaccinated, I'd probably say, why am I doing this? How we looked at, not testing vaccinated students. And I'm also just curious as to, how we might do that if that were an option. And again, I'm thinking also of like savings in funding, or what is the argument for screening all students?
Yeah, I'll talk just to clarify. It's not a requirement to do everybody. It's a requirement to do unvaccinated. So at the secondary schools, we would have to probably do the similar process, and students, we'd have to develop whether or not we're doing that in class. And there are students that are vaccinated next to students that are unvaccinated. And if you recall, this kind of came up around masking in the summer. CDC came with recommendations that vaccinated students did not have to mask. And I think some of this was around the encouragement for vaccinations. And our state decided for no vax shaming. So I think that is something we have to come up with a system, whether it's in the classroom or whether it's pulled out separately on how to do that, as best and as gently as we can to the population, so we don't get into that shaming situation, and develop a system that would be not intrusive to classrooms as much as possible and not evasive to the individuals that are doing it. So I don't think we have a good answer, and I don't know if there's anyone else that has experience on the panel on what that looks like.
Did anyone on the panel want to weigh in on that?
Well, I think I'm just going to reiterate what Mr. Mazzara said, which is that was really I think the thought process that the state came up with, was that they really didn't want to, stratify the students. And really the only way for us to do that is to treat them all equally. And so I think that was a really important component of what the state was thinking about when they made those recommendations.
Thank you. Director De La Cruz, and then Director Sheffield.
Thank you. Clarifying question. The kind of screening tests are the pooled system that you described earlier, Mr. Mazzara?
Yes.
Okay. So if somebody in the pool, some unidentified person whose swab is in the bag of, classroom 22 comes out positive, then we're kind of waiting, right? All of that time until that person is then able to, like, the whole class is quarantined, the whole class shuts down. What happens under a pooled system? And then a kind of follow-up question is, why pooled? I know that was a question that we raised a couple of weeks ago. And is it a question of cost, of kind of privacy? Because I'm just concerned about the kind of space between a pool testing strategy and a positive test that then results in, kind of additional days of risk between that time.
No, I think you certainly identified the logistics around, okay, Monday, the test comes back to room 22. Now we're coming back on Wednesday, we're doing the rapid test, we're identifying, but you've had 2 days certainly of potential, close contact and increased infections, of course. I think getting back to why aren't we doing another type of test? So the state program is around pooled PCR testing. And that's kind of what's coming to us from the state. Their follow-up is the rapid test. The members of the public health community can back me up on this, but right now there are some shortages around the rapid tests. And I don't know if there's enough capacity if we wanted to do it and if we wanted to pay for it. I'm not sure right now there's enough supply in California for us to do every student every week with a rapid test, as an example.
Thank you. That was exactly where I was going with my next question. I know we're trying to just do two. So I'm hoping that that's my second one, which is, hearing about this program in Marin about the rapid test. I would love to know, is it a supply issue, a cost issue, or an efficacy or, kind of validity issue?
I think there's a little bit to everything. In my conversations with public health, the CVS test that they're taking, there's some validity questions and there's recommendations from the team here that we don't allow those because there's a validity question of who took the test and how well was it administered. And so, I think the same test administered in a valid way is a whole different question than the same test. Well, we don't know how it was administered. And I think our panels will reinforce that. That's one of the concerns of this and I call it the CVS test, But that's one of the concerns about at-home testing is the administration of it and the validation behind it.
Thank you.
Welcome.
Director Sheffield?
Thank you. So you know, I guess in the discussion on screening testing of all students and really talking about the unvaccinated, particularly the younger students at the elementary level, I'm wondering what the concern over privacy and legality with students who have, for whatever reason, or family has opted that student out of testing. What happens to their privacy when the whole class is taking a test together collectively? Obviously, there would be these students who aren't. So are there violations of their privacy? How do we address that?
Mr. Eckstein, I would have to defer.
It's a great question. And maybe Mr. Mizera, if you could speak again to specifically the there are going to be some privacy considerations around specific student information or student health considerations, but the taking of the test, if that's done, I wouldn't be implicating necessarily their particular right of privacy, but I do think it's an important consideration when we're going through some of those processes to be mindful of. I think when Mr. Mizera was talking about those different procedures on the pool testing, that it is something that should be factored into, but the way it's presented right now, I don't see it as from a legal standpoint as violating those who are voluntarily, consenting not to participate in that testing.
Director Sheffield, the testing company and the conversations we've had, they've talked about this has happened across the country. They gave me examples about Baltimore where they had opt-outs, and they've done this in Massachusetts. So there are schools that are already implementing this across the country where they are doing this thing, and this company is doing that. Of course, California will have its layer onto the federal world on that, but they said they're working through this in many cases. They had concerns, as they expressed to me, about not having an opt-out, but they said that's not our liability. That's of course the district's, and they're just saying we'll come in and administer either whole class or partial class, whatever you all decide.
Yeah, that's my concern as it comes back to the district. And I know a part of the discussion is also having the option to take the test at home, and then that removes the privacy, but it also possibly removes the disruption in the classroom. We might not get the same results, the results that we would intend to if we can observe and monitor that the test is being administered as correctly as possible. But that's something for us to consider. Is that my understanding?
It is. I think we can consider, I don't think the doctors would disagree that if we required a PCR test, as an example, that is your opt out, but it has to be a PCR, not the rapid CVS test. Forgive me for using that, right? I think they'll find validity in that because those are administered in a valid way through labs like we're doing ourselves at Lewis, right? Mm-hmm. So I think as long as there's the PCR requirement, that I think it would meet the validity concerns that medical staff might have.
Thank you.
All right, Steve, moving on. You were going to masking, I think.
Yeah, I think the last piece, we probably don't need a slide for this, honestly. So you all know the current recommendation is for indoor when you're in the presence of others, that masking is required, just as a nuance. Teachers that are in the room by themselves, district office people that are in their offices, that's not a requirement, but obviously in the presence of others. Our Department of Public Health does recommend, they strongly recommend, right, in the language that they mask outside as well. And with the exception of eating, that I think is another consideration that board you could look at as we discuss this. And this would be a great time for anyone to explain the benefits of that, and what that looks like. So just, again, for board consideration on terms of masking, that's another layer to this that we can make a decision. And so that's kind of what I'm throwing out there, and love to hear from panel members.
I just want to reassure you that we are all still here. We're just being quiet, waiting for someone else to talk.
Is
I
Dr.
see
Mace
Jenny-
going to respond?
I don't know, but actually I think that Jenny is probably the best person to answer this question because she's really the most boots on the ground in terms of the exposure events that are happening at the school. And she's really seeing what's happening with the modified quarantine when the kids are unmasked outside. So not to put you on the spot, Jenny, but I know you know this like the back of your hand.
Absolutely. So like I explained before, I'm a nurse and I work directly with the schools when they have exposures of COVID-19 on their campuses. When that happens, we work with the schools to identify close contacts. And from there, once they figure out who has been a close contact to the COVID-19 case, they then determine the nature of the exposure. So if the exposure was mask on mask, meaning both the case and the contact were wearing a mask, then the child who was exposed, so the contact, they can do a modified quarantine and stay in school. But what we've been seeing so far with this playing out in this school year is that a lot of students are exposed outside when they don't have masks on and they're in close contact with others. And so those students are no longer eligible for the modified quarantine where they can stay in school. So our best practices that we've put together includes universal masking outdoors as well to help keep kids eligible for that modified quarantine, thus keeping them in school. And that's really the big push for that one right now.
Now, let me also just add, there is definitely a risk of transmission in settings, even outdoors, where kids are very close to each other and they're not able to maintain the 6-foot distancing. Obviously, when they're eating and things is a risk. And the high recommendation for masking outdoors was really based on the fact that there still is a risk with the Delta variant, which is much more highly transmissible, even in an outdoor setting. And it's not an order, it's a high recommendation. And so we felt that that was adequate for now, and we'll follow the data and see what it shows.
I'd like to follow up on that. This is Lori Fong, and a Marin County School District or a school limited outdoor eating to 14 minutes to keep under the 15-minute exposure. Can anyone talk about that? Does that make sense?
We could talk about that. Yes, definitely. This has been a big topic lately because, it's been in the news, and our team has been working intimately with those districts that have implemented that. We actually advise against the 14-minute lunch for a couple reasons. First reason being kids can't really eat lunch that quickly. That's a little bit fast for them to be trying to force food into their mouths. But the second reason is because if those children are also, or those students, if they're also being exposed elsewhere, like during the classroom time with their mask on, then they're already meeting that 15-minute threshold. So unless that time that they're eating lunch for 14 minutes is the only time that they've been in close contact with the positive case, then they are not eligible for the modified quarantine anyway. Does that kind of help explain?
It's 15 minutes cumulative, right?
Right, yeah. So if they're 14 minutes unmasked at lunch, but then they're, 6 hours masked during the day in classroom, they're well past that 15-minute threshold already. And portion of that has been unmasked. So right now our stance is that if any portion of the 15 minutes is unmasked, then they're not eligible.
Jenny, have you heard of any school where they just basically did half day?
Currently doing half days?
To avoid lunch?
We definitely did see that in the springtime. I think most schools were doing sort of a half-day schedule, but for the fall, I'm not aware of any that are, but that doesn't mean there are not.
Thank you. I see Trustee Medina's hand is up.
Actually, can't answer my question.
All right. I see no other hands up.
Director Fong, if I could just, there's one more piece I wanted to conclude on, and it might
Thank you.
spur some greater questions. Let me go back to my shared screen. It's kind of getting back to the volunteer question. I know that's of topic tonight. So I wanted to be clear. Is this good enough? Do you guys need me to go to full screen? I want to be clear. The weekly testing is for workers. Now, this is a Cal OSHA rule, and they've include workers as meaning volunteers and people that work at school events. So I want to make sure the board has time to consider this, that what that interpretation has meant is our parent volunteers in the classroom or on campus would fall under the same provision, that any volunteer that comes like this would have to go through the same requirement of providing appropriate dose, the double dose if appropriate, or provide weekly testing. This includes everything from chaperones driving on a bus or driving cars for athletic events, the workers working at a snack bar. So I want, when we say we're going to do this, I just want to be inclusive. This is what the current guideline is referring to. And so as you think about what that would look like in policy, please understand when we do that, where we have to do it to this group as well. The instance, the caveat is single instance, like I'm coming to an IEP, coming to a single parent conference. But if I'm any kind of volunteer that's coming on a regular basis and participating with our students in that, we have to go through that process, and obviously the easiest thing for us to do at this point would require volunteers to be double vaccinated. We could build that into the requirements to be a volunteer, and that would satisfy this practice. But I want that to be clear, you guys, so you make sure you know when you're making decisions on that. And a question, Dr.
Vice President McCormick.
So on that point specifically, so we don't have to give volunteers an option for weekly testing. We can make if we want to explore the volunteer route, we can have a higher standard and just straight up mandate a double vaccine, fully vaccinated for all volunteers. Can we do that, or do we have to be held to that and give them that option?
I understand that's totally within your jurisdiction. And Mr. Eckstein, am I missing anything?
No, you're correct. That's just the floor in which you have to comply with. You can certainly go above that.
Thank you.
And Trustee Medina.
Yeah, actually, my question goes back to masking, and I don't know if this is a question for Dr. Mace or who, but is there a threshold of vaccination, say 80, 90, 95%, that would then maybe the County Department of Public Health provide a guidance that then at that point it's okay to not mask?
That's actually a great question. Let me say it's a question that's come up with the Bay Area counties. So what are the metrics and what do we use to back off on the orders, like the masking order, or say, for example, testing of unvaccinated? And it is a good question. I think we need to follow all the metrics. Our case rates, as you are all aware of, are already dropping, hopefully as a result of some of the things we put in place, but maybe also just generally what's the natural course of the infection and the Delta variant. So I think it's going to be kind of a mix of the whole pattern, like where we're going with case rate, the test positivity, hospitalizations, deaths, and the percentage vaccinated in the county. And remember that even though we have 75% fully vaccinated, there are pockets in our county where there's far less vaccination in some areas than others. And those are areas that are microcosms of greater transmission. So I am, and public health is looking at the bigger metrics to determine when we'd be able to back off on some of these things.
I think that, your response to me sounded more like bigger picture countywide, but what I'm kind of looking for, I'm kind of thinking of it in the context of like motivation to get folks vaccinated in our schools, where like within that specific time period where students are in our schools, if let's say 90% or whatever amount of the students are, then we can say, oh, well, because our school is this percentage rate vaccinated, the county would not require folks to wear some masks. So I'm wondering, is that some sort of guidance that the county could apply for like schools, like if you're vaccinated at this rate, or are you only gonna make those types of recommendations on that large level scale?
Yeah, it's something to think about. I want to remind you, however, this is a state order. So the order is to all schools in California state. And so we don't really have an impact on that at the county level. I can certainly have that discussion with the state, but it'd be really up to our state program to determine those kinds of things.
Thank you.
Director Taylor Cruz.
Going back to the slide, Director Mazzara, around what we require of volunteers, and I'm thinking, is it just on campuses, or is it volunteers at any school event? Because there are, for example, a volunteer at cross-country meets, and that's at Spring Lake, but it's an SRCS event. So are those requirements the same off campus and on campus, as long as they are related to school?
I may have to defer. I did not hear a specific incident like that. It's a school event. So I don't know if that comes under the auspices of that, or the recreation it's at Spring Lake where it's held. I don't know, Mr. Eckstein. I didn't hear that come up in the nuance of the webinar that I attended.
I'm sorry, could you repeat that again?
Sure. So the kind of, the ability or our reach, our jurisdiction over school events, events that also happen off campuses, right? Like meets in parks. But if it's a school event, we can also require kind of additional or above minimum, above the floor requirements for school events. It's not a campus question. Is that's really what I'm getting at?
Correct. In fact, you actually, I think you have much more flexibility around, say, sporting events and other extracurricular activities, where you don't have because in your school setting you have a right to an education. So there's only certain things that you can and can't enforce, but there's no constitutional right to a lot of these extracurricular activities. So that gives you much more discretion in terms of what you apply.
Yeah, so that leads to my next question, which is, I'd love for us to be really transparent and clear about, all of those places in our school systems where we see that higher level of requirement in place, because there is, kind of an opting in to being in a deeper sense of community with each other. So I'm thinking particularly of athletics, where you have, coaches and student athletes who are actually required to, and have been required much earlier than what the county order required to provide proof of vaccination or to submit to weekly testing. And I maybe it's just provide proof of vaccination, period, and otherwise you can't play. So I'm curious about, I'm aware that that's true in athletics, for example, but I'm wondering if there's other examples throughout our system where we have gone above the floor and, required additional mandates as a result of people's opting into places.
I think you've identified two of our options for athletics is one, extra, curricular activities outside. No, they're school related, that's different. And then the volunteers. Those are the two areas that we're actually, targeting. I was going to bring it up in another context, but athletes are required to be tested weekly right now. We're not doing it We are waiting to see if we are going to test our students weekly, so we don't double test our athletes. And so if we don't do that, then we are going to go like we were doing in the spring. We'll be doing weekly PCR testing of students. And if the board members may remember, that means there are students that get pulled every week, and it's going through a cycle of that process. We haven't begun that yet, but depending on your movement, where we go with that, we will begin to implement that very soon as well.
Okay, so I guess that's just a kind of a request for further information about where are all of those different places within our district that we have gone above, right? The kind of floor mandate. And I'd love to just have that information so folks can see that you can opt into something beyond a floor, and that it, how does it feel, and what does it feel like, and what does that look like, and what does that add to students' ability to participate fully in lots of different environments, just outside of their learning as well, or their classroom.
I think we might get there in our discussion. Steve, let's go on. Do you have the last part on VAPA and athletics?
No, that was just the only discussion we were going to get in terms of the board discussion and optional. There are requirements that just they are what they are. There are no levels of board consideration on those, except the weekly testing like I just described.
Can I, sorry, I had one more follow-up question. Do we require proof of vaccine or anything above kind of the floors that we're talking about now for electives? So for band or things that are not, right, that are choices of kids choosing into something?
Director Later Cruz, we're going to be doing that next, so hang on to that, okay? And then Director Medina, you had your hand up still, or what?
Yeah, it was a new question.
Go ahead.
My question was, well, I don't know if anybody's in San Francisco lately, but if you want to dine anywhere, you're required to show your vaccine card. I'm just curious in terms of like volunteers, if let's say we allowed volunteers to come on campus, I envision something where maybe they have some sort of ID, but that maybe it also has like a copy of their vaccination card on there. Is that something that we're inhibited from doing in any way? I don't know if maybe it's a legal question.
Let me just say this before Mr. Eckstein, we currently go through fingerprinting, TB testing for our volunteers. We do that internally through HR. I don't think it logistically is a problem then to add proof of vaccination to that decision on whether before you get clearance for volunteers.
I don't mean just in clearance though. I mean, like if they're wearing a lanyard that actually shows their card, because I think like, yeah, internally we would know they're vaccinated, but like other people around that then, they have proof to reassure people that this is a vaccinated person.
It's a great question. I think that actually goes back to what Director Sheffield was raising around privacy concerns. I mean, we have to be very, very careful about, disclosing health information about individual volunteers or staff members and students. I think that it somewhat depends if you have a blanket mandate for all volunteers, then presumably you don't need that placard, because then everyone's by virtue of being there has been vaccinated. And perhaps the workaround is simply that someone has a card that says they're a volunteer, and you may sort of indirectly understand that they are therefore vaccinated, but it isn't quite as direct as calling out their sort of medical status in a public setting.
Okay.
President Fong, that concludes. That concludes
okay.
My part. So please.
Okay, so we're going to hang on to that, and we're going to go back to Superintendent Trunell. I think you're going to present something on VAPA athletics.
No, actually, Steve, Mr. Mazzara, if you could speak to that.
Yeah. The discussion tonight, we're looking at options for policies that would be going into the plan, the approval plan. Those are the requirements for athletics, and VAPA are requirements. There's no board options. We have to abide by those. So we didn't think it would be too significant to have a discussion. We'll bring those forward as appendixes to the COVID plan for next week.
Thank you.
So just because I'm so curious and I can't figure out how to do this, let's say you have a whole room of saxophone players or trumpet players in the band room.
Yeah,
they
there is
playing?
already requirements. They have masks, they have holes in them. That's a requirement they have to have. They have to have a cover at the end of their bell that collects that. Yeah, those are all requirements that are absolutely required and in place.
Thank you. That was in the weeds. Superintendent Trunnell, is there anything else?
I think, first of all, thank you for all the very thoughtful questions from our board, and thank you to our panelists who were able to weigh in on a variety of the conversation. I think the next step, Board President Fong, is to now go back and look at those options with the board on each section and hear from the board recommendations that they would like the staff to consider.
Okay, so board, just as a reminder, we were talking about student and staff testing, student and staff vaccinations, masking requirements, and then athletics, extracurricular activities, safety measures. I think that last part. And Mr. Mazier, would you go back to each of those slides?
I'm sorry, President Fong, there's one more. I don't know if it's included in your student and staff testing, but we also were getting into a discussion around parent family volunteer testing.
Correct. Okay, so let's add that also. So Steve, would you go back and kind of show us that those slides, those pertinent slides, and let's start out with student staff testing.
I will. Let me do the share thing. Okay, so this is around the staff testing and vaccinations. The requirement, again, the requirement is for unvaccinated staff or staff that are incomplete or refuse to determine their vaccination status. They have to be tested weekly. And the considerations there for the board to look at are everything from how basically do we include vaccinated, if we want to include vaccinated staff in that same analysis, and what that looks like. And that's, we could do random versions, voluntary, require staffing at testing at work like we described. They could opt out of at work, but provide it on their own. And then, just the requirement of all staff, vaccinated or unvaccinated, equally.
All right, board, we will take discussion for, let's just try for maybe, let's see how we do in about 10 minutes or so, 15 minutes on this, and let's just watch our airtime. And this is what we're talking about now, testing. I see Jill McCormick and I see Ed Sheffield right now.
So we're just talking about staff testing right now?
We're talking about the slide that's on the, staff testing and mandatory vaccinations, and our discussion about it and options that we may want to choose or nothing.
Could we put the slide back up?
Of course.
So after Jill, I see Ed, Alegria, Omar.
Okay, so on this specifically, my thoughts are that if you are not fully vaccinated, that you must submit for testing weekly, and there is not an opt-out option. I do have a question about, and maybe it's a legal question, of why we have the option to not release why we have the option to not release if we're vaccinated or not. But I guess it doesn't really matter, because then they would be put in the category of assuming that they're not vaccinated. And so they would have to abide by our testing rules, right?
Exactly.
Okay, so so I don't think we should have an opt-out on this. I think it should be required for anyone who is not fully vaccinated. However, I do feel like we should not require testing for fully vaccinated workers. That's just my opinion. Now, I think we should be able to offer it if they have a concern, if they feel they were exposed, or if they have symptoms, or a breakthrough case or something. So I want to offer that as an option, but I don't think it needs to be a weekly option. These are just my thoughts. I'm not a doctor. These are my thoughts on our policy on this. And I also think we need to consider carefully and closely and communicate our protocols for missing tests in the cycle, and what is required. And then also, as a caveat to that, what happens when people do test, but we get an inconclusive test? And are they going to be out or not? Is this something that needs to be negotiated with our unions? But I think it needs to seriously be considered, because I know where I work right now, in the situation that we have, if somebody misses their test, they're out until they provide a negative PCR test themselves. So they're out because they're out of cycle until that PCR, those results come in that they're negative, and or until they get back on cycle. This is just my experience, but I just want you to hear an example of how this is played out in other places. And so you know, people can be out for 2 weeks based on that, if they miss a test. And so I'm not making any assumptions that people are going to intentionally miss tests. I know that like life happens and sometimes you can't get your test done on a day, but we need to have some sort of protocol established for that, as well as when we have inconclusive tests. And then the other thing that's a concern of mine, because I've experienced it myself, where I work, and we also use color, we contract with color. And so my experience has been that the turnaround time on the PCR test can be quite a while. It's not a 24-hour, 48-hour thing. It's almost always at least 3 days and up to 5 days. And so we just have to know that that is the case. So if someone gets out of a testing cycle, it really backs things up. So that's an issue. And then I really, this is my last thing I'm going to say, I really feel like, and I don't know how this works everywhere else, but I don't feel that our staff, our district staff and workers should be burdened by providing and running the testing. I feel like we need to work with county and with who we're contracting with to allow our students and our workers to be tested, and someone else is running that for us, and we're just complying and doing the actual tests, and people are self-administering their tests and turning it in at the designated time and location, and then that's it. And then someone else is taking care of everything for us, because to use our resources doing this is it's too much. It's just too much. And I also don't think it can be a burden. I don't think it can be a burden on our staff. And I don't think it can be a burden on our students and our families. So we need to figure out a way we will comply with these testing requirements, but we need to provide that, or that needs to be provided for us as a district, so that it can be effectively run and not pull so hard on our resources, which are just absolutely strapped right now. So those are my initial thoughts.
Okay, thank you. Next.
Sure, I will be brief. Director McCormick covered a lot of what I wanted to speak about. So I really would, and I said it before, I would like us to examine our non-staff parent family volunteers and requirements around testing, particularly if they have volunteered to demonstrate they are fully vaccinated. I do think that this is a way for us to address staffing shortages that we know are there, and the need for additional school site support, and to capitalize on the willingness of families to help out. I know personally I'm missing my time that I spent in the classrooms helping out. I would volunteer my time personally as well. And I also think that this is a way to address the regression. I said it at our last meeting, I hate the term learning loss. I don't deny that it is it exists. I just think it's relative, but I do think that this is something that maybe we really should focus on considering. We heard from a lot of parents this evening who are wanting to step up and help us out.
Thank you. I think I'll agree. You're next.
Thanks. I'm supportive of requiring all staff to be vaccinated. I believe that, and it's my experience and looking in my research, that people who are in close contact with vulnerable populations, as our children, especially our elementary school children who do not have the ability to be vaccinated at this stage and who are at high risk for contracting COVID, I'd really love for us to look at what it would take for us to require all staff to be vaccinated on our campuses. I also am supportive of, figuring ways to bring parent volunteers back on campus with that same requirement, right? So if you want to come in and be part of our system and work with our kids and be around our kids, then we really want you to be vaccinated. I appreciate the strict medical exemptions. I know that, that provides an ability for folks who really can't be vaccinated to opt into another system that works for them and their bodies and their health. Completely agree that we should not be testing, not have those responsibilities on people whose jobs is education, and with all the additional burdens that come from that. And I'll stop there.
Thank you. Director Medina.
Yeah, I mean, pretty simple. I support the final option requiring of all staff to be vaccinated. To me, it's what makes most sense, both from a fiduciary and public health perspective. It's what makes most sense. And I think we, with Director De La Cruz and Sheffield, I'm totally in agreement that we need to work on getting more of our parents back on campus if they've been vaccinated. I think our staff need the support, and I think our students, need that additional engagement. So we got to do what we can to get our schools back to normal, but also keeping them safe at the same time.
Director Flores.
Thank you. So I'm also in support of of requiring all staff to be vaccinated. Vaccinated. I also, like to say that I think it's important to do at least some sort of random testing, because having outbreaks could be a possibility. So it's important for us to catch those, positive cases before they become, outbreaks. And I'm also, I'm hearing the parents here, talk tonight about being able to volunteer. I second that motion of being able to do that. So that's where I stand on this. Thank you.
Director Meniere.
Yeah, I'd like to just add my voice to supporting vaccinations for all of our staff. I think that it's the socially responsible thing to do, and I'm very supportive of that. I also agree with Director McCormick that our staff and our students and our families should not be bearing the brunt of this testing. And I was actually even thinking, how can we work with other partners? I know that some community-based organizations and even local community clinics are looking into really utilizing trusted messengers and community health workers to help educate and to not do some of this work, but definitely ease some concerns around it. So I'm wondering just how we can integrate some of that into this work. I also I'm supportive of the random testing for the reason that I think that we need to catch an outbreak before it happens. However, I would like to see that happen in a way that that does not interrupt the classroom. So we're already dealing with a lot of interruptions. So just I don't know if there's a way that we can do that logistically where it's not interrupting our students and our staff during the day or during class time. And also, I'm also supportive of ways that we can bring parents into onto our campuses to provide support. I'm really appreciative of those who brought this idea forward and who emailed us and messaged us about this. I think it's a really great option. So I want to see how we can do that.
I think it's very clear that the board is pretty much on the same page, because I also feel that we need to support mandatory vaccination, but I will give you the reason is that we work in a public institution. This is public education, and our public health departments, federal, state, and local, have recommended vaccinations. And so that's what we're going to do. I agree that parents need to come back. We need them, and they need to be with the kids, and absolutely with all the vaccine and all that. The vaccinations, it is a burden for us, right? We are not a health agency. I don't know how we are going to do random testing of vaccinated staff. I don't know if we have the capacity. Before we get everyone vaccinated, we may need to do this though. So whatever we can do to get outside help, and I know we are working on that, and we have ramped up quite a bit, and I know we are not stopping at that. So let's just keep track of what actually the capacity is. And I see that Jill McCormick has her hand up one more time.
Just something for us to look into as far as creating access for our employees and our families and students, well, the students specifically. A lot of models that I've seen out there set up clinics for both testing, and they run simultaneously testing and vaccination clinics. So you can just walk up and get your vaccination right there. And it seems to be a pretty good model out there. I've seen it a lot. And so looking at some sort of model like that would be really good. And then publicizing it and getting that information out to our families and to our employees. I think that would be something important to look into.
Superintendent Trudell or Steve, do you have any comments or clarification to the board?
I just want to be sure that I'm capturing everything that is being recommended tonight. What I'm hearing is that the board is, and I know that we did not hear from every member, but it sounds like we have a number of board members who are recommending that we move forward with mandatory vaccinations for all employees. So I just want to be clear that I heard that.
And we did hear from every single member.
Okay, thank you. And then I want to be clear that we will create allowances for volunteers who are vaccinated and or be tested weekly to be allowed to start coming back and supporting in our schools. I heard that.
Wait. The volunteers need to be vaccinated fully.
100%, no testing. Okay. Thank you.
Yes.
I also heard about, and I have a clarifying question. So around the capacity for testing, are we talking about having an outside agency test all 15,000 of our students weekly? Are you saying that the asymptomatic testing, the symptomatic testing is where we need the help? I just want to be clear. Are you talking about the screening testing being an outside agency, or are you talking about the symptomatic testing being an outside agency?
I would submit that we are the symptomatic testing that we are throwing out there to an expert agency.
I actually think that I would extend that to both. I feel like our resources really need to go to educating our kids. And we know how little resource we have to be able to do that right now. And so anything that's taking away from our being able to do that, I feel like if people are spending time collecting test kits and taking them places, that means that they're not, right? They're not able to focus on what we all know needs to happen.
Yeah.
So I would be in support of both.
I'd like to also add my voice to that.
Best case scenario, that's what we would like, but in reality, 15,000 kids, a little difficult, especially with capacity, but yes.
Well, we're not going to have to test 15,000 kids because I don't think we're saying test the vaccinated kids. So what's our number? What's our elementary number of the 12 and under that cannot, or under 12 that cannot get vaccinated? And then what's our number of, I mean, I don't know. Have we collected that data yet of our 12 and up vaccination rate? It wouldn't be 15,000. It would be less than that, because I don't think we're saying that we're weekly testing. We're going to require weekly testing for fully vaccinated students and employees.
Okay, so what I'm hearing is that we would consider, and we haven't started collecting that data on student vaccinations yet, because we needed to move through this discussion. So what I'm hearing is that the recommendation is that we would test students who were not vaccinated. I think also we would want to ensure that we are looking at the angles for families who want to opt out of that process. And I'm looking at Seth. I know that, you weighed in a little bit on that earlier, and this is new territory, certainly.
Yeah, excuse me. The general model that I've seen is that they set it up as it was presented earlier as an opt-out with the or requiring a consent. So specifically getting consent from families on us submitting to testing, and beyond that, I think there's I think there's that question of it. What are the consequences? How do you enforce that? That's not to discourage the board if that's how the avenue they want to take, because a number of school districts do take aggressive approaches in their own way. But that I just did want to flag that's a concern. That's a sort of an unknown that essentially how do you enforce that ultimately if you don't have that consent.
If I could say something, just because I think it might help your discussion to frame it. So it may be useful to consider the elementary schools differently than middle and high schools, because in the elementary schools, at least what we know nationally, and I think what our experiences here as well, is that most of the COVID cases among elementary students are not from transmission in schools. They're from either at home within their family, or the family attends a gathering like a birthday party or a wedding. And so, and even when there is transmission within schools, it depends. The best indicator for transmission in a school is your COVID rate in the community. So, and then the third factor is that teachers are the most likely, or other staff are the most likely persons that transmit in the elementary schools. So those factors, I think, create a different environment than what may exist in the upper grades.
Dr. Mace?
Yes, thanks. I would agree completely. And I just want to add that the reason that the high recommendation for testing all students, regardless of vaccination status, was put out is because, first of all, it's a congregate setting, basically. people are packed in. It's a place where something like the Delta variant could be easily transmitted to fully vaccinated students in addition to unvaccinated. And also, it's hard to operationalize vaccine verification among students, simply because you get the parents and they may not want to give that information. And it's very hard to tease that out. It's different than vaccine verification at the employer, because that can be mandated. Here, it's a much more difficult thing, which is why I thought it might be better to simply have surveillance testing for all students. And I get that that's really difficult in a big school of 1,400 students, which is why we changed the language on the recommendation to say whatever resources allow. In other words, it doesn't have to be the full student body every week. It could be 25% of the student body every week, or 50% every 2 weeks, or even testing of 50% every month. Some sort of frequency of testing would be good. We did this in the skilled nursing facilities. It was flexible. They could do 25% every week of their staff and residents. And so anyways, there is some flexibility, but that was the reason behind the high recommendation for not taking vaccination into consideration.
Thank you. Director Medina.
Yeah, so well, first off, 12 and under, obviously we're on a consent model. In terms of operationalizing getting vaccine information, I'm curious if, it shouldn't be too difficult to, in that consent, requesting consent to allow for parents to provide an answer that says my student has been vaccinated, and or provide some sort of verification of that in that process, right? Because regardless, we can't test any students 12 and under if we don't have that parental consent. My question is around the 13 through 17-year-olds, where I believe, if I recall the slide, it said student consent required, but I was wondering if a parent can consent on behalf of that student, even if this, let's say the student didn't want to consent, or can the parent just consent? I'm just curious how that works. If anybody has an answer to that.
Yeah, I'm not certain, and I wonder about whether for the students who are 13 to 17, because they can consent, does this fall into their ability to speak for their own health? And does a parent, like other kinds of situations where parents can't consent over a student's right, or 16 and older, or rules like that?
There is some nuances to that, and I don't know if the county council is still on the line. I'm not sure if he's advised other school districts on that particular one, because I would want to make sure that I got that right, because there is a bit of nuance to that 13 to 17. I can certainly get back to you if he's not available.
I do see Mr. Radke on the call. Yes, thank you, Mr. Radke.
Yes, I have not. I have consulted about the issue of 13 and older consenting. I have not consulted about whether or not a parent could consent over the objection of a 13-year-old. I would need to dig in a little bit deeper about that, and it may be addressed in the school guidance, but my computer froze, so I can't pull it up right now. But I can get back to you on that.
Thank you.
I'm going back to just the point in general. I think regardless of the testing that we choose to do, we're going to have to get consent in some sort of way, and I think that's an opportunity to get vaccination data. I just want to throw that out there and make sure that we get it, whether we vaccinate all students or only whether we test vaccinated students or only unvaccinated students.
So
Director
I
De La
just want to be
Cruz.
clear, this area that we're talking about right now is with regards to staff. Is that right? Okay, so I guess I want to just stay kind of like on the testing and vaccination requirements around staff. And my understanding is that we're going to get to the students next.
Yes, thank you.
Okay, so I just want to add my support for this idea of maintaining some form of testing, regardless of vaccination status of staff. So mandatory vaccine mandate for all staff, and then some form of randomized percentage-based testing on a regular basis of our staff.
Director Manieri.
Yeah, thank you. I was going to say the exact same thing, and now I'm wondering, where do we have the conversation about the burden to staff and students and families for the testing, just so that we don't fall into this loop again?
So I just want to be clear, we're talking about staff testing right now. And in that case, and Mr. Mazzara, correct me, but our plan was to simply provide the tests, like for example, in their mailbox. They would do it when they have a break or have a chance to do it and drop it into the receptacle where we are asking them to deposit those. So we're not asking them necessarily to do that during their instructional time per se.
Absolutely. And with the outside temporary staff, it would not impact much, simply collecting, making sure that the person on random test in this case, let's say, actually did it. So we think it's very minimal to the existing employees, and we're putting the burden on the temporary staff that we're trying to use.
And I just want to highlight too that we have a huge set of our employees who are not teachers, where they can take care of this during their day. And it's, so I know the intention here is talking about ensuring that we're protecting instructional time. We have an entire set of employees that aren't in the classroom per se, that this also applies to.
I can answer that earlier question about the consent by a parent, or I can wait until the discussion about testing for students.
I think that Vice President McCormick has another comment.
Well, I just want to get a little more clarification on if we're testing regardless of vaccination status. And I'm speaking specifically about staff right now, but then obviously it's a much larger number if we're talking about our students. So Director Mazzara, you're telling me that it is not much of a burden on district staff or whoever it is that is in charge of supplying the tests, getting the tests to the employees, and then collecting the tests?
Yeah, the conversations we've had is,
yeah.
I was gonna say, using our contract vendor, we're doing all the logistics and the scanning and the setting and prepping, all that. We're simply the burden as an example would be if I'm doing a 25%, let's say, of the school site that day, right? Those 25 are selected. The school secretary has just walked this through, would put them in the boxes. And then at the end of the day, make sure they put them in a receptacle, and our team would come around and pick that up again. So literally, I think that's the burden that we would see at a school site.
So we would not be in charge of scanning them before they go out and scanning them before we deliver them?
Our vendor, our temporary people we're hiring would. We are not putting that impact on our employees.
Okay, thank you.
Superintendent, would you just come back with us in terms of what you understand in terms of testing and vaccinations, what you've heard from board? So we're crystal clear.
Absolutely. So speaking specifically about staffing, the expectation would be that we move forward your recommendation would be that we would move forward with mandatory vaccination of all employees. And I want to just give a caveat here that when we do that, and if we do that, if the board takes action on that next week as a part of our COVID safety plan update, the next steps in that would be that we would be bargaining with our labor groups around the impacts to that. We could continue to move forward, but we would have to negotiate the impacts to that. I just want everyone to know, because people may ask, well, why does that have to happen? That is a requirement. So just want to be sure that's clear. And then also what I'm hearing is that we would do random testing of all employees at a percentage, whether that's 25% or what have you, but that we would do random testing of all employees weekly. Did I get that correct?
If not weekly, as Dr. Mace was speaking about.
Or every other week or something like that.
As we could.
Mm-hmm.
I think it's as resources allow.
Right.
And then maybe it's like as resources allow with some floor, right? But at least 25% of our school population. And I'd love, again, Dr. Mace, Dr. Lobato, is it monthly, weekly? Like what is the frequency of the randomized percentage testing that you would recommend be sufficient? And just to be clear, how many teachers and staff are we talking about total?
About roughly 1,600.
Can we get that answer back after you have a chance to check on that, Superintendent Trudell, and we can talk about it?
Yep.
When
I have the answer. I'll just look it up right now.
All right, can I ask one final question for clarification?
Go ahead.
So you brought up the MOU and the right for the union to bargain, Superintendent Trudell. So on today's agenda, we have an MOU. Does this mean that the conversation that's taken place today, there will be more conversation with the union, and we'll have to do this, what we're doing later on today again?
Yes, for the impacts of their, maybe Seth, you could probably articulate.
I can jump in. Sure. So basically, the decision for the district to decide to say all staff will require to be vaccinated. That's a decision the district can take essentially on its own. It has the prerogative to make that decision. You don't have to sort of bargain that first. But this kind of decision is going to result in certain impacts to the staff. So for example, we were talking about earlier about the cost, right? Who bears the burden of the cost, or who bears the burden of, the time they need to go to get the vaccine, or we talked about earlier, the discipline consequences, right? If someone chooses not to comply with this directive to get vaccinated, what's going to happen? Those are the kind of things that the effects of this decision, those would need to be bargained. So there would need to be some sort of, probably some MOU down the road to address those.
Thank you.
I think there was a question for Dr. Mace or Dr. Lobato or someone else regarding the suggested frequency.
So are we talking about the testing of vaccinated or unvaccinated teachers and volunteers and staff?
All.
Well, the state order is quite clear that all unvaccinated teachers and staff should have weekly testing.
I think the question was about when a staff is fully vaccinated.
Mm-hmm.
What percentage would you recommend? How often would you recommend testing?
Well, if you want to test all vaccinated staff, that would include volunteers and everybody, right?
Correct.
Yes.
Yeah,
Everybody in contact with kids.
So it's going to be a lot more people. So again, I think there should be some flexibility in that. In other words, you're doing surveillance testing. Anybody who's symptomatic obviously is not in the mix. And you're also doing surveillance testing of a group that's much less likely to get COVID than the unvaccinated. We know from our data that unvaccinated persons are much higher at risk. So I guess, first of all, my question would be, you know, do you have data that you should be doing surveillance testing of vaccinated staff and volunteers in schools?
That we should be?
Yeah, that you should be, because that's not the state order. That's also not what, you know, we're recommending at the county, because we know that vaccinated individuals are much less likely to get COVID. I mean, I understand if you want to do it, it's just that that's going to be add 70% to your numbers at least.
So I think, Dr. Mace, the question was, if we have a vaccine mandate for all staff, is there a need for some small level of randomized testing throughout our system to just surveil? So, and what would that percentage or that frequency be? So I think you mentioned kind of 25% every month or something like that.
Yeah, I see what you're saying. So you want to do surveillance testing, kind of background surveillance testing of even vaccinated staff. Well, you know, there's no data to guide this, but I suppose, you know, you could do 25% every 2 weeks. I don't know, Dr. Lobato, I know I'm putting you on the spot as well, but you were involved with the skilled nursing facilities and the surveillance testing of staff there. Of course, this was sort of before vaccination, but what would you think would be appropriate if they want to do sort of random surveillance testing of vaccinated staff?
Well, it depends how much COVID there is in the community. So right now, our data showing last time we looked at this was 0.7% of vaccinated persons in the county, and 75% are fully vaccinated in the county right now. So less than 1% have had an infection, breakthrough infection with COVID after being fully vaccinated. So it happens, but it doesn't happen often. So as hopefully this surge in COVID declines, I would think that less surveillance testing is needed. So currently in a skilled nursing facility, which is a very different environment, but unvaccinated staff are being tested weekly. In a school setting, I agree that you can do less frequent testing and you know, a random testing, or making sure that everybody's tested 25% a week or 50% every 2 weeks.
Yeah.
It's reasonable.
If you were to do that, the good thing is within a month, you could look at your data. If you got no cases amongst vaccinated people, then you know that you're over testing. You can back off and potentially stop or go to 50% every month or something like that. So whatever you think your resources allow seems reasonable. There is no data to guide what percentage you should test every week, every 2 weeks, every month. Again, I want to underscore what Dr. Lobato just said. The risk is much, much lower in vaccinated individuals. So if you want the bang for the buck, that's not where to focus testing. If you want to do a little bit of surveillance testing, why don't you just test like 50% of your staff every month and see how it goes?
So I guess my question here is, do you have examples in other industries where there are vaccine mandates in place in a congregate setting? What is the amount of surveillance testing that's happening in those industries or in those congregate settings with a vaccine mandate on the books?
So you're talking about a vaccine verification, soft mandate, correct?
That's a great question.
Because there's a soft mandate that's vaccine verification and testing of unvaccinated individuals. There's a hard mandate, which is a requirement for vaccines, unless you have a medical.
We're considering the hard mandate right now.
And
so if we had a hard mandate in a congregate setting,
Okay.
What would the recommended frequency and percentage of testing be in order to provide some base level data around the efficacy of that mandate?
That would be testing of vaccinated people?
Yeah, there is no mandate for
There
testing.
isn't.
So you test if there's somebody symptomatic or if they have an exposure.
Yeah, so far, you know, with the hard mandates, vaccinated people are not, or even the soft mandates, there is no requirement at all for testing of vaccinated individuals. The only areas where we're recommending testing of vaccinated individuals is the student body, and that is a high recommendation. It's not an order. And it's because there's so many students in one school that it's like a congregate setting. And again, as I said, it's really hard to verify vaccine status. The other place where we're testing vaccinated and unvaccinated is inmates when they're incarcerated, because that group has extremely low vaccination percentage of like 27%, and they have very high risk. And it's a good time to screen them, whether they're in a congregate setting. And our outbreaks have shown that fully vaccinated people can easily get COVID and transmit to others in those congregate high risk settings, like corrections and homeless settings, homeless community settings.
Would you make a comparison between that form of congregate setting for vaccinated staff with unvaccinated children? Is that a similar comparison?
No, because unvaccinated kids aren't high risk. They're very, 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 very low risk. They don't have underlying conditions. They don't, you know, the things that are getting, the things that are driving the outbreaks in homeless shelters and potentially in the corrections are that people have underlying conditions. They're older, you know, they've got risk factors. So even fully vaccinated individuals are getting COVID. I think it's much, much less likely in the school setting.
The best way to protect children who cannot be vaccinated is to vaccinate the adults around them.
And to have a mask mandate at school, especially in an indoor setting and in outdoor settings where kids are together and aren't socially distancing and are all on, you know, on top of each other, essentially.
Dr. Mace, thank you, because you have segued us into our next thing to look at for options, and it is a slide titled Student Testing and Vaccinations Options for us. Steve, you can put that up. I think that's your next one. It's slide 20. So do you want to walk us through this? And you're muted.
Thank you. Again, there is no student requirement. You see the recommendation that Dr. Mesa just mentioned, that that's a recommendation that they're doing. There's no requirement on vaccinations either by the state. In other words, like the LA Unified position requiring all students to be vaccinated. That's obviously one of the conversation pieces. In addition to that, we can talk about the testing of students. You know, again, there are layers to it. We can talk about random testing of vaccinated and unvaccinated students at the secondary level, voluntary testing, that's the opt-out provisions we were discussing earlier, rapid symptomatic testing of students. I think the only concern I have, that's a great in theory, but that was the action about we don't have those rapid tests. We would love to do rapid tests in the schools immediately in an isolation tent, you know, before the student goes home. We don't have those tests available, and that's not funded by the state at this time. And then required screening of testings for all students. That's the weekly screening for everyone, vaccinated or unvaccinated. And then the other option was to allow the kind of the proof of testing if you don't volunteer to do your testing in the school setting. And this was the three ideas, you know, the opt-out, the no opt-out provision. if we're testing everyone, the opt-out but provide proof, and the opt-in with consent. So that's the framework around student testing.
And
So
if I
I
could
guess,
just jump in too, because Adam, I believe, had shared that he had an answer related to the parent consent over student consent.
Yes, actually, and it's actually addressed on that slide. It says for children aged 13 to 17, the child can consent or the parent can consent. It's actually on that slide. That was pulled from the state testing consent form.
So what I'm hearing you say is if a student says no in the 13 to 17 range, if a student says no, a parent can say yes, and the student would be required.
Yes.
Okay.
All right, so board, let's discuss this. I want to remind board that it is 8:37 and we have a consent item also to discuss. And we've got 3 more. We're still on this. So let's not get into the super duper weeds, and because we also have next board meeting to talk about this after our superintendent brings back what she hears from us. Okay. So I see Omar Mardina and then Stephanie Manieri.
Could we go back to the previous slide real quick? Okay, so, I mean, first off, thank you, Dr. Mace, for your information. I think that really added some major insight to me. Out of these options for consideration, like what sounds most appealing to me just off the top is the rapid symptomatic, but we don't have tests, it's not funded by the state. So if we were to do any testing, which right now I'm wondering if we should even go to that extreme of burden right now, given everything. I would maybe support just random testing of students. And I assume that in this process, somehow in the beginning, we would get consent from parents and or students like in advance, and then any random testing would happen, or would the consent happen in the moment of testing is kind of what I'm curious process-wise.
the only thing I would answer is students would have to be signed up in a system if we do the pool testing, so that would be, they'd have to get somehow signed into the system. We could do it for them, of course, just through a student ID number. And then when it comes time for testing, that would be the consent, like you said. But we could do some of that up in advance without their consent. And then when it came time for testing, we'd have the logistics already pre-worked out.
Director Manieri.
I have one question before I perhaps give my comments. Well, what would it take to have symptomatic or rapid symptomatic testing of students, or even just symptomatic testing of students on school site in the isolation tents?
So in addition to having the tests available to us, we have to have the staff that would be willing to do it. Right now, there's been great hesitation from our associations on testing actual symptomatic students. I don't think I could have the capacity, we are attempting to get outside vendors to come in at every school and stay there and do that. So right now, in addition to the actual rapid tests that we would have available, the staff to perform that is also kind of a burden that I don't think I have personnel that I could do that with.
Okay, so it sounds like personnel is not an option, and I think that, I mean, I don't want that burden on anyone in our system. I think that I agree with Director Medina. I don't know if the pool testing is what I'm supportive of, or random testing. I don't know if there's a difference, but I'm definitely in favor of, or I'm supportive of testing of students within our capacity. However we can do that on a weekly basis to get as most students as possible.
Director
So could
Flores.
I just weigh in for a second and just,
Yes.
I want to just
absolutely.
clarify what the orders and recommendations are. So everybody is really clear. There is a state order that mandates vaccine verification. And if any staff, including parent volunteers, et cetera, at the school cannot show proof of vaccination, they need to be tested weekly. So unvaccinated staff, volunteers at school, K through 12 schools need to be tested weekly. In addition, here in our county, we have issued a high recommendation that all students, regardless of vaccination status, be tested in some frequency. And weekly may be good for small schools. For larger schools, that may not be doable. That's why we're saying you may do 25% every week or every 2 weeks, 50% every couple of weeks or every month, whatever fits the ability to test. And that's both vaccinated and unvaccinated. The pool testing is a good idea. There are pros and cons to it. The way that works is you pool the specimens and test, and if the pooled specimen is negative, everybody's negative. So you've done 15 tests or 20 tests or whatever you're doing, and you know that they're all negative and you can move on. If it's positive, then everybody needs to be retested individually. Okay? So you got 15 students, you pooled their tests, you sent it, it's positive. Every single student then needs to have a PCR for confirmation of who's the positive one, or is it more than one that's positive? And then once you get that result, you do a contact investigation around the positive student, not the negative ones. The advantages of pool, when you have a very low risk of a COVID, when you have less community transmission, and our rates and numbers are decreasing over time. We're down to a case rate of about 15 cases, new cases per day per 100,000 population. So, and our test positivity is down to somewhere around 2.5 to 3%. So it's reasonable to consider pooled testing, but it has to be done correctly. There's definitely operational challenges with doing pooled testing. But if you're able to do it effectively, you do a lot less testing, obviously. But when you get a positive, you do a lot more testing to figure out who the positive was. So I can just clarify all that. There is no order or recommendation for testing of unvaccinated teachers, staff, or parent volunteers at this time. So if I could just put that into context, and those are the recommendations that we have and the state has.
Thank you. And I think that brings up a question for me. Director Mazzara, are we set up to do pool testing, or are we, I mean, so now I understand the difference between screening testing and the pool testing. What is your recommendation that we do based off of your knowledge of our student population and the schools and the sizes?
You know, again, looking at our data has been dropping over the last 3 weeks. Absolutely. I think our testing vendor says they're doing it and they can do it for us logistically. I am providing staff. I think it's something that we could look at and we could manage and just see how it does for a limited time. And at some point, given the case rates, you know, it may continue in a certain community and not in another. I think we have to follow that data. I think it makes a lot of sense for us to follow through that. It fits the athletic guidelines to be able to do that. You know, we're going to do that regardless. So I think logistically, to answer your logistic concerns, we have some things to work out. I think in the opt-out setting, I'm just trying to imagine from a teacher side, if we allow the opt-out, then, you know, it's up to us to encourage why you should opt in, how it's good for the community. You know, I think it comes us in an educational mode, which of course we do well, to talk to students on why you should opt in to the volunteering, the testing protocols and how it helps your family. So I think there's some good things that we can kind of build on an educational piece around it. I think it's worth consideration, absolutely.
Director Flores.
Okay, so Dr. Mays answered quite a bit of my questions actually, but I think we definitely need to have some sort of basic surveillance testing, just to be sure that we're not a place where we'll have an outbreak. So in terms of doing random testing and pooling testing, as long as we are able, and as long as we can see that we're doing it effectively. I mean, the pool testing, I think at this juncture, that sounds like it's enough, of a random sort of testing sort of tool to make sure that we are monitoring, our student body. But then I'm going to go a little bit further than that and say, if we can add some sort of random testing component as well, just to make sure that we have the data for for about a month, and that way we can come back in a month and say our positivity rate amongst our students is one of the lowest in the county. There's no reason for us to continue this. Now we'll have the data to go back and say, what, we can actually reduce the percentage of students that are being tested, or completely stop the program. But I think we need the data to indicate that. And at this point, the data that we have is from a lot of symptomatic students or people, right? And not randomized asymptomatic students that they're probably not getting tested because they're asymptomatic. That's it.
Director Medina.
Thank you. I wanted to clarify just also on my recommendation, the time factor. Like my recommendation of the random testing is not on a weekly basis. Maybe a month. I know Dr. May suggested maybe a 25% testing, but to me, if we were doing 25%, on a weekly basis, that's about 4,000 students a week, or maybe a little less, which is a lot. To me, maybe something more like 10% seems more feasible and doable, and I think still kind of accomplishes. And I think if we're doing 10% a week in terms of testing, we're still getting students tested on a weekly level, but not every student tested weekly. And I think I don't know if I'm misunderstanding or if others are misunderstanding, but to me, the pooled and the random, the pooled is random. You're not, I guess that's just my point. Pooled is random testing. You're not doing everybody in your pool testing, right? That's what the random testing is, correct?
Well, there's different layers to it. So we could do every student that opts in every week, or we could rent in a pooled setting. Pooling is the mechanism, let's say. But we could then switch that. Instead of every week, we could go every other week. We could go twice a month. We could go monthly. So pool is just the methodology of how they do it, right? Rather than an individual sample. You could still pool test in a random or a percentage process.
And again, the purpose of all this is to catch cases from when there's asymptomatic people, right?
Exactly.
And even if we don't choose the rapid symptomatic option, when we have symptomatic individuals, there's still going to be some sort of action, right?
Yes.
So board, I want to weigh in here, and I see your hand up, Alegria. I liked, Omar, how you said, what is the goal here? I think we are indicating our goal, and I think I really stand with Dr. Mace and the expert that our Department of Public Health recommends screening testing weekly. And that is not random, and it's not weekly. It depends on our resources. But the whole thing is about how do we make sure that kids are safe? How do we make sure that our schools are safe for everybody? So whatever that is, 25% a week, and we will get there. And if we do it pool, that's fine. If we do it like per kid, that's fine. But I think that our direction is what we're going to give to our superintendent. And then based on our resources, district will figure out, administration will figure out how we can make this happen. And also it will depend on, you know, what the case rate in our county is, because by the time this all rolls around, it could all be different.
If I can just add one thing, the good news is you can always track your data and come back and look at it and make any changes that you want. So in a way, it's almost better if you were to, you know, start with the unvaccinated staff and the volunteers and all. If you're going to do a random sampling of the vaccinated, you'll know within a month whether that's fruitful or not. If you get no positives, then you know. With the students as well, when you start testing, I think my recommendation would be track your data. Let the data drive what you do.
Dr. Mays, could I also ask, if the board were to look at, let's say, take the strong recommendation for outside masking, would that mitigate any requirements or reduce the perhaps need for random testing instead of weekly? That may give a layer, right? We talk about layers of protection. Would that add a layer that might then reduce classroom testing, the need for classroom testing?
Well, it's a great question, I have to say. But there isn't a lot of data as to what to do there. So I am going to defer to Dr. Lobato, Maya, Dr. Kimura, who may still be on, because they deal a lot more with the transmission in schools and what's going on there. So can one of you respond to that?
Maybe several of us can, actually. Let me just say, most staff are not infected in the school, right? They're not infected by children usually. Now, there are outbreaks, there is transmission in the school, but the majority are going to be infected in the community or at home or somewhere else out other than the school. So the masking helps prevent transmission within the school, but it, you know, we don't know what people's personal practices are outside of the school. Whether if they go to some familial gathering or go out with a group of friends, whether they're actually masking when they're in those groups, etc. So that's where we that's part of the reason why we have the mask mandate. Jenny, do you want to add anything?
Sure, yeah, I can add a little bit more to that. Additionally, with the mask mandate, I think part of that initially coming from the state was for it to be universal was mainly because they wanted to reduce the possibility of stratifying of groups. I know Maya touched on this earlier with the testing issue, but also in terms of masking, because if we stratify the groups of vaccinated versus unvaccinated, we can see a rise in bullying. We see a decrease in the mental health of our students. And so that is definitely a piece that has played a part in that masking mandate coming from the state.
Thank you. Director De La Cruz.
I think my comments are in line with this idea that we have like a continuum of protective measures that we can take. The strongest being a vaccine mandate for all staff. And then, sorry, my connection is unstable. Are you still hearing me?
Yes, we do.
Okay.
We can hear you.
If we have a vaccine mandate in place and a mask mandate inside and outside, then it really reduces the amount of surveillance testing that we would be required to do without those things in place. And it would reduce the level of stress and the level of, you know, churn and work that's on our staff, and that's on, you know, the stress on the parents to consent and kids to try to make these decisions on the fly. And there's something about that consistency across those protections that to me really shows the strength of those kind of mandate actions that really reduce the need for us to surveil or screen or or track. And so I really like what I think I heard Director Medina say, which is with a mask mandate and a vaccine mandate in place, then we have the ability to do random voluntary testing. And I like that combination that allows people to, you know, opt into the additional protective measure of testing when we really have these two strongest measures in place as requirements.
I read somewhere that it's called the Swiss cheese model, right? There's like, you guys have heard that. So at this point, Superintendent Trunell and Executive Director Mazira, I want to ask us any questions or clarify or tell us back what you think you've heard.
I know, and so forgive me as I've been taking copious notes and capturing various perspectives. I don't know if we've, I want to be sure that I'm clear. We're talking about testing for students, for example. And what I'm hearing is that we will go with a consent model for students 12 and under. And for students that are 13 to 17, they will be expected to test. And I want to be sure that I heard that correctly. And that the last part of that is that for the testing, we would do random testing. So it wouldn't be all students, it would be a percentage of students. Did I get that correct?
I don't think that's what I was saying, but I see Allegria nodding her head and I can't see the rest of you.
Can I just ask what you mean by random? Because a percentage of students being tested every week or every 2 weeks is not random.
So I think
random means you just kind of generate a list of your, let's say you have 1,000 students, you generate a list and you pick 10% of them through a computer, like randomly, you know, that kind of thing. Whereas if you're doing 25% every week or 50% every 2 weeks or 50% every month or whatever, that's not random.
Thank you for that clarity. And I think what I'm hearing from the board is that we would want to be sure we test all of our students, but we would test a small percentage each.
Okay, then that's not random. That is a sort of, how should I put it, staggered testing approach or model.
Thank you.
And so that was what I actually thought. That's what I know I was saying. And I think that's what our board is saying. The county's recommendation. So not every week, but everybody is testing.
Okay, thank you for
We're
that.
getting percentages and we're looking at the data as it comes forward, and we will have that data, and COVID will change and more people will be vaccinated, and it's that Swiss cheese model, and we may not do that forever.
So can I just ask a point of clarification on the voluntary nature of everyone? Right, so if we're doing everyone some percentage and a regular, you know, at a regular time, are we still saying you can opt in to this testing?
I'm not saying that.
Wouldn't it be actually the opposite, like they opt out and then that's the voluntary nature of it?
Yeah. Director Medina.
Yes, so going back to the issue of randomness, that's what I was asking earlier, like if is pooled random, and I guess a more clarifying question to get to Dr. Mesa's point is how, because I was thinking that it would be random in the sense that you would randomly select the class and that would be the class that was pooled or something of that nature. So I guess maybe I would need to know more details as to what that random process is for that option.
Well, I mean, if you want to do pooled testing, you should do pooled testing throughout. In other words, for all of the grades and classrooms, or you should not. Now, if you want to randomly do pooled testing to see how it's effective, then you randomly choose, you know, a few classrooms to do pooled, and everybody else gets the regular testing, and you can look at it and see, you know, I mean, this doesn't have to be scientific or, you know, a study or anything. You can just say, oh, well, these 3 classrooms, we're going to try the pooled approach and see how it goes. And the rest of the school, we're going to do the regular approach and see how it goes, and see how it goes essentially. And it won't be anything that's scientific or a study, but let's just say you have a good experience with the pooled testing in the 3 classrooms, you decide to do it, then you say, hey, let's expand this and do it to more of the classrooms. It has nothing to do with randomness. You're still testing everybody at some kind of regular interval. And that's not random.
Sounds like we should get rid of the word random.
Yeah, because random means that it doesn't make any sense.
Right. Okay.
You know, why would you do random testing? You want to try to, do surveillance testing, which generally is not like a random process.
Superintendent?
Thank you for that. And I want to be clear. Did the board take a stance on the vaccination piece for students?
We did not.
Okay. So I think I'm clear on the testing piece. For what it's worth, we are contracted with the state to do the pooled testing. So that will be at no cost to us. And if for some reason a positive test does come back in that pooled sample, then the state will also take care of the cost of the individual tests. However, that is with the company Ginkgo that we will be contracted with, which is the other agreement on the consent agenda tonight in order for us to move forward with that. If we decide to use a different distributor and we want to do individualized testing, like through color, that potentially could be a cost to us. So differences, just want to be sure everyone hears that.
Just for clarification, what was the student vaccination component that you're specifically referring to?
So the student vaccination component is, has the board taken a position or a recommendation on whether we would require students to be vaccinated?
I just want to be clear, because I thought I understood from our last meeting that it was the state that imposed like requirements on vaccination of students, not
that is
us.
correct.
Am I wrong? So then we wouldn't decide that. Right?
We didn't.
Well, it's my understanding that we can do it, but it opens us up to liabilities and a lawsuit and monies associated with that.
That is correct.
So I'm going to be on record that I am not going to be requiring all students to be vaccinated. Could change if COVID changes. All right, we are going to move to slide, Steve, the next one, which is about masking, slide 22. So we see 2 options there. Do you want to chat about these?
Right. Obviously, we're following the current recommendation of indoors, except when a student or staff are kind of by themselves. We can continue the outdoor one, except when eating. One of the provisions, just so you're knowing what we're trying to work on right now, primarily with the younger students, are standardized seating charts from where they sit. It's been very difficult for us, and public health and us have worked together on identifying close contacts when they're eating. It's much more difficult for the little ones to remember who they sat next to when they eat, and that is obviously a major component of transmission. Very concerned because, as mentioned, you're not eligible for a modified quarantine in that setting. So one of the layers that we're putting on this is when there is eating, elementary schools are going to a kind of a fixed assigned seating. So it's really easier for us to kind of describe to that. I think what we're discussing is the strong recommendation that we wear outside. Public health has said that. You heard that tonight. That might be another layer in your Swiss cheese model, President Fong, of where this might, reduce some transmission. But, I just go to the panel. I just also heard that transmission is not a huge factor at schools right now too. So I think the information that's coming forward is really critical for us. And so that's what we're going with this slide. For your recommendation, it is another piece that we could move into in the COVID safety plan. We could move to required outdoor masking.
Required outdoor masking. Okay, I'm sorry. Aren't we, we are
No,
already requiring them?
No, we're indoor. We are strongly recommending. We are not policing outdoors.
And do we need to do the same for elementary and secondary?
We could consider different stances. However, with the requirement for outdoor masking, there will be the question of discipline if not worn. Right now, with the strongly recommend, there is no discipline because it is at the option of the student's choice. If we move to mandatory outdoor masking, we could get into a conversation about progressive discipline around that.
And before I call on all the trustees, what is Dr. Mesa's recommendation and the other experts we have?
It is best practice. That's part of our recent best practices. So a strong recommendation.
Strong recommendation. All right.
To require.
Okay. Let's start with Director Sheffield.
I just want to, express my concern around any type of discipline route, especially for the little ones, again, who, for the most part, and you see it on playgrounds. I'm sure that teachers see it at schools. I see it with my kids. Is they do their best. They wear their mask, and sometimes when I notice when I'm walking down the street and my kid's wearing his mask, when we see someone approaching, that other person, an adult, will put their mask up and respect that this kid is trying. But I just have, I think where we're at right now with the strongly recommended, is it effective? I want to hope that it's effective. I'm just worried about any type of discipline that we add on to that. It's just adding a burden of stress to kids. Oh my gosh, you didn't have your mask up, or it slipped down from your nose, and it continues to happen. It might continue to happen to one particular kid. I just would hate to see that kid be singled out when he's just a kid. So that's just a concern that I have. And again, this is around the littler ones.
Thank you. Director Manieri.
Yeah, I have the exact same concerns, and I don't know what the conversation around the discipline could even go, or where it could even go. So something that sticks with me is actually from the last board meeting. Our student board member made a mention about how it was the older students were having a hard time kind of deciphering, well, if it's strongly recommended, like when do we and like when don't we? And so I definitely heard that message coming from her. And so I kind of lean more towards requiring the masks of students and staff at all times, including outdoors, because it's a uniform policy. But I have a lot of concerns around the discipline piece, and I likewise, I wouldn't want to see our students be singled out, or having to have be singled out for not following that. If there's a way that we can provide support rather than punish, I'm definitely for that. But I am in favor of kind of this overall safety policy that we know keeps our students safe, and is also just a very clear message to our student body about what we're doing with masks.
Vice President McCormick.
Sorry, I turned off my camera instead of my mute. I support just keeping it as a strongly recommended option for outdoors as far as mask mandate goes. I just think it is the rate of transmission is so much lower outside in fresh air situation, and I just there's so much to manage here. It is such a heavy lift that I think there are more important things that we should expect our educators and administrators and employees to be helping manage and police. And this is a hard one to do, even if we do mandate it. So I think strongly recommended is where we should stay.
Director Medina?
Yeah, just the same thing. I just think we should continue the current implementation. I think adding too much change or confusion and is too much at the moment. And I think we also got to look at the facts on the ground. I think that's one thing that we've heard a couple times from outside folks that, look at what's going on in the community. And I think the indicators right now and the data that we've had locally is kind of okay in terms of how it's spreading. I think if it gets a lot worse, then maybe we could reconsider. But I think right now, continuing what we're doing is fine.
Director Alegria de la Cruz.
Thank you, President Lori Fong. I like the idea of a mask mandate, moving beyond the strong recommendation into a requirement with no discrepancies. I think that clarity is important for kids, and the same inside is the same thing that you do outside, and it's the way to protect each other in your community. So I really like moving beyond, or I like being able to implement a best practice.
I like that best practice. Director Flores, Clerk Flores.
Thank you, President Fong. So, working in the school, I wear a mask pretty much every time I see a kid or a parent indoors, right? And when I go outside to take a break, I go outside primarily to take my mask off, right? Because I need a breath of fresh air. Watching kids in the recess setting, they're all wearing their masks. Some of them, have them, halfway there, right? But it looks like they all have them on. And if I go to a kid and I said, can you put your mask on because I need to talk to him or her, right? They do that. And I'm going to go with what Director McCormick said. I think the current implementation of strongly recommended is sufficient at this juncture. Yes, it would be best if kids can wear all the time indoors and outdoors. But I'm really, really worried about what will that entail in terms of discipline and policing, kids having their masks on at the elementary, middle school, and high school level, and then at the high school level, you become, students become a little more anyway.
Independent.
There. Thank you. I was looking for a word like that. Thank you. So anyhow, that is my recommendation, and that's where I stand on this one. Thank you.
And Nurse Jenny Strait.
Hi, I just wanted to voice again just a little bit more emphasis on the rationale behind our best practice recommendation for requiring masks outdoors. While it is true that the risk is a lot lower outdoors, the definition of close contact does not change whether you're indoors or outdoors. So if kids are not masked outdoors and they are exposed during recess, where there's upwards of 50, however many kids playing outdoors, then they will not be eligible for modified quarantine and they'll have to quarantine at home. So that's really the rationale behind our recommendation for having it be a requirement, is so that, we can have more kids be eligible for the modified quarantine, which will allow them to stay in school during their quarantine period. Just kind of wanted to reemphasize that after hearing a little bit more discussion about the transmission risk. Thanks.
Thank you for that. Thank you for that. So can I just go back and say something, President Fong? That changes my perspective. I did hear, Director Mizera talk about that. I'm gonna go with your recommendation of making this, a mandate. So I'm changing my stance. Thank you.
Thank you for that recommendation. That's a consideration.
President Fong, could I ask Jenny Straight a question?
Yeah.
Jenny, would that apply to vaccinated individuals at the secondary level? So I'm a vaccinated person. I had lunch outside. I was not wearing my mask, but I'm vaccinated. Am I
If
still?
you're, sorry, yes, if you are a close contact, but you are fully vaccinated right now, you are currently exempt from needing to quarantine.
Right.
So in that population, the secondary population, that will be a lot less of an issue, except for, when they're unmasked eating and I'm sorry, unvaccinated.
Right. So Director Flores, where I'm going with that is a vaccinated person, masked or unmasked, can stay at school if they're a close contact. So changing the masking requirement would not send home a vaccinated student at secondary school.
So
But
this
it would impact the unvaccinated student.
Right. You took the words out of my mouth. It would impact primarily primary schools. Got it. Or elementary schools. Okay, thank you.
I'm going to go with strong recommendation despite Nurse Jenny, but best practice. So we just drill into the kids. This is why we're doing it. This is why we're doing it. And then we cohort the kids at recess, and the kids at high school hopefully are going to get vaccinated. I think that I'm going to go with what Director Flores said in the beginning about how we need to go outside. I mean, even adults outside eating at a restaurant who are vaccinated and outside they're unmasked, and so adults outside in the park are unmasked. I'm on a hike, I'm unmasked and vaccinated. So
At a Raiders game.
yeah, no, they're not going to be here very much longer, maybe. So
Can I say one thing to that, President Fong? Very respectfully, like, I totally understand the differences, and we go to restaurants and we're outside. But I think for me, what's most important is keeping kids in school. And so that, for me, that's why I want to see the most protections possible, because we have, and some parents are right, we haven't had a lot of conversation about regression or learning loss. And so I want to see kids stay in school. And I think that a mask mandate will do that. And I don't think that it's equivalent to comparing it to adults going to a restaurant.
fair enough. But then when we're looking at transmission rates too. All right, so I think we're kind of split on this. Maybe. Superintendent, what did you come away with?
It sounds like you are split. And I don't know if there is a single person who hasn't weighed in. But I'm hearing the nod for staying with strongly recommended outdoors. And I'm also hearing the nod for requirement outdoors with the caveat of no discipline in the event that a student chooses or for some reason doesn't have their mask on.
So I think we had 2 board members advocate for mandatory. And I think everyone else advocated for.
I counted 3.
We have
Yeah,
4.
Ever, Stephanie, and I are all for a mask mandate with no
okay.
discipline. I think the only discipline that I would like a kid who is not who's violating the mandatory mask mandate is to have 5 minutes of a science conversation about how virus is transmitted without a mask. That's what I would like for that kid to go through if they don't have their mask on in the playground.
President Fong, for clarity on that conversation, an outside football game. Is this applying to our campus, or is it applying to our students only? I just want to put that out there, because currently, if you're coming to an indoor game, it's a requirement. So if I'm coming to a volleyball, basketball, it is a requirement to have a mask, adults and students. So I put that out there for consideration.
It's a thing to consider. It's not up to me, but I would say that's our policy. It happens on our campus, so it applies to everybody.
Thank you.
All right, so Superintendent, I'm going to let you chew on this for the week, and we'll bring it back on Wednesday. And I think Omar and Nurse Jenny would like to say something else. Medina, Director Medina.
Yeah, I think I'm just kind of responding, I think, to Director Manieri's point of like, keeping our kids in school. And I think of like, will our schools shut down again? And I don't think that's going to happen. I think, looking at where we're at as a community, just in terms of vaccination rates, I think I heard something along the rate around 70, maybe a little more early on. I think as long as we continue to increase our vaccination rates, our community overall is going to get safer. And I think our kids will remain in school. And I think why we closed down was because of how extreme it was and how infectious this was. And we didn't want it to spread. Obviously, like we now have a vaccine, we're at a better place. So I'm really pushing for us staying where we're at. I just want to also emphasize that I think if we make it more stricter and harder by requiring that mandate, not just for the students, but for everyone on the campuses, we're definitely going to get a lot of pushback. There's going to be a lot of angry parents, a lot of angry people. And I know that I'm always looking forward to being outside, being able to take off that mask. And I'm sure there's a lot of other people that feel that way, as Dr. Flores mentioned. So I just want to kind of reemphasize that as we move forward with the decision.
Nurse Straight, did you have another comment?
Just one more recommendation that we have that would pair with a mask mandate would be to have mask break areas designated at schools. So I know that some districts are implementing things like this, and it would essentially be an area where people can take their masks off for whatever amount of time, and they're just more supervised in that area to make sure that there is physical distancing, social distancing happening in those areas. So no concern necessarily for anyone to be exposed as a close contact in those mask break areas. Thank you.
Thank you for that. Alegria, I see your hand up again.
I really want to just thank Nurse Straight and for the medical professionals on this call for telling us what a best practice is. And I want us not to fall prey to what I've seen so many different jurisdictions fall prey to, which is a loud minority that is flying in the face of science. And they can be difficult, and they can write a lot of emails, and they can threaten to do lots of things. But we only stay in a good place as a district, as a jurisdiction, and as a community if we're really prioritizing science and telling people that this is the best way that we can take care of each other during really hard times and try as hard as we can to go back to normal. And I love Nurse Straight's option of, a mask-free space to give people, that glorious feeling of what it feels like to take off your mask after hours and hours with it on. Because I know we all know what that feels like. But I really hope that, that we lead with science right in the middle of our decisions, with love for our community and a real vision to what it means to go back to a place that we all really miss, and to recognize that so much of the kind of anger and the churn that we feel as decision makers, actually, like, we can continue to say, yes, we understand your loss and your grief and your anger, and we're actually working really hard to make sure that you don't have to go through that anymore. But we slide back when we slide back into bad places when we don't follow expert opinion from people who are working in this field every day that tell us this is our best practice. So I just off my soapbox.
Here, Alegria. Thank you so much for your words. They're really well received. I just want to let people know that you can reach out to us in public health anytime for questions, for any kind of data, literature that you want. So we're here for you.
Thank you. Should we move on to our next one?
I think we're
Was that
done.
the last one?
Mr. Mazera, did we cover?
We covered our presentation.
I believe
Absolutely.
so.
Thank you.
Thank you all.
So if we are, okay, so we are going to open this to public comment again, is what I said, and we agreed to 30 minutes of public comment at 2 minutes each. So we'd like to hear from our, any stakeholder who'd like to weigh in.
And while we're doing that, just thanking all of our guests tonight. We will not be responding to these public comments. So unless you would like to hear what our public is sharing, I do bid you a good evening.
Thank you so much. Good night.
So members of the public who would like to comment at this time, you have 2 minutes for your public comment, and we have a limit of 30 minutes total. Please raise your hands. Our first comment is Motorola. I'm guessing this is Mr. Stahl, Gerald Stahl.
Hello, you guys hear me?
Yes, is this Mr. Stahl?
It is.
Thank you.
There's a lot to comment in 2 minutes. I've been in this meeting for hours now. And there's a lot of concerns from all of you people. There's a lot from Anna. There's who else is in here? Steve, I believe. Steve. And then there's also, we must have lost somebody, your legal team there. But first of all, Anna, I'll be honest with you. I've told you guys this before. My kid's not allowed to be tested. I don't give you consent to test my kid. And so if your legal team needs to give me legal papers stating that my kid can't participate in your school, that's fine, and we should do that. Second of all, with the mask mandate, what is your guys' deal? I mean, the kids leave your school and they walk down the road. They have no mask on. What do you think putting a mask on outside is going to do except take the air out of them? That's all it does. And for the other people that think that going to a restaurant isn't equal, I mean, get real. Are you serious? You really think that you're above them as kids? I mean, this is ridiculous. I mean, do you people even hear what you're saying about this? I mean, I'm almost disgusted with this conversation. I've been on here for hours and nothing about the kids, nothing. It's all about you guys and what you guys want to do. Think about the kids. These are our kids. They're not your kids to make decisions on. We as parents need to. That's all I've got to say, but I'm pissed.
Thank you. Next is Stacy Ponce.
I have a question actually for not only school, but for Dr. May.
Stacy, are you there? We can't hear you.
Hear me?
We can barely hear you. If you'd like to try to reconnect, I'll go to someone else and then call on you as soon as you're back.
Can you hear me now?
This is better, yes.
Okay. So I have a question not only for the school, but for Dr. Mason.
You know, now we cannot hear you. I'm going to move on to Stacia Okura, and Stacy will try you again in a bit. Oh, sorry, it's Silas Martin is next.
Good evening. I'm the parent of a middle schooler in Santa Rosa City Schools, and I want to be clear that if you do pass a vaccine mandate, I will child out of the district. I will not put an independent study program. And I'd like to speak to all parents out there, whether you're concerned about your child being forced to be vaccinated or forced to be tested. Pull your child out of the district. You can engage in homeschooling. I will help any parent move forward with homeschooling. I will help you design curriculum. I've heard a lot of talks about science tonight, but I've never heard natural immunity mentioned once. The CDC estimates that 100 million Americans have been infected with COVID and recovered, and they have natural immunity. I keep hearing science, 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 but nothing about natural immunity. I'd also like to ask you why you think a vaccine is more robust and has more longevity than natural immunity If the White House is asking you to get a booster shot after 8 months, you say you're following the science. Have you looked at any peer-reviewed studies? Any scientific peer-reviewed studies? What are you basing your decisions on? I'd like to know what all your decisions are being based on. And for any Santa Rosa City Schools employees that don't want to adhere to a vaccine mandate, I suggest you walk. They're having trouble in California even getting substitutes right now. You're all sitting up here like you have all the power and you hold all the cards, but you don't. This is offensive to me. I'm a father, protect legacy in your health. Whether I love or the thing, well, I do, and I'll fight for my daughter. Thank you very much.
Thank you. Next is Stacia Okura.
Good evening, Superintendent and School Board. I'm a parent at CCLA, and my main comments are on the surveillance testing for students. I agree with not requiring surveillance testing for unvaccinated students and with offering an opt-out consent. I understand from the discussion that the point of surveillance testing is to reduce school-based transmissions, but I'm really questioning the need for such a burdensome and costly initiative. And this is why I don't think we should be doing surveillance testing. We've already been in school for over a month with no surveillance testing. We already have very low case counts in our district. Over the last 5 weeks, there were an average of 20 positive cases in our entire district. So to implement this extremely logistic heavy program costing close to $500,000 for temporary staff, you're talking about catching 20 cases last week, less than 1/10 of 1% of our student population. And on top of that, our community case rates are dropping. And it seems like you're considering a really burdensome program to solve a problem that we don't have. So I guess I'm just asking, does the district have data that demonstrates that we have a problem with school-based transmission? And if you do have that data, can you show it to show that we really do need a program like this? I think our low case rates demonstrate that the mitigation measures we have in place are working and they're preventing outbreaks. Yeah, I think rather than spending the cost on this program and developing protocols and testing, we should be using these funds for restorative justice and other programs to address mental health. Thank you.
Thank you. Next is Sheila Walker.
Hi, hello. I wanted to just state that at the beginning of this meeting, I guess about 4 hours ago, I think I indicated that there was $60 million in COVID funding, and I think I misstated that. So I wanted to correct myself. I think it's closer to 26 million. This whole discussion about the testing system seems to be extremely complicated. Just listening through all of this and your discussion, yet the board is spending so much time and energy on it. Just as the previous speaker spoke, my question is, do we have extreme breakouts? What are our numbers? Is this a worthwhile program? Meanwhile, we have schools which are currently understaffed. And from the comments earlier at the beginning of this meeting, they seem unsafe. And that's not because of COVID. So what are we putting our efforts on right now? And it seems to me that we may need to provide some safety at many of our schools, and we're spending hours talking about whether or how we should pool test or how do we do these other tests. Also, I just wanted to note that Director De La Cruz just mentioned about following the science. Well, yeah, I want us to follow the science, but we've had numerous doctors, including Dr. Mace, and then the other gentleman who was speaking, saying that we are not transmitting, that the children are not transmitting COVID at school. It's being transmitted in the community. Why are we doing this? Why is there a budget concern when the district received millions and millions and millions of dollars from the state and federal government specifically for COVID relief? Where is that money? There's no discussion about the kids. This group just discussed that there are currently no progressive discipline for our labor partners. However, there will be discussion, or there already are, disciplinary actions for students. Are we?
Ms. Walker, my apologies, but you've reached your 2-minute time limit. Next is Joe. Joe, could you please state your name for the record?
Did you hear me, Joe Porcaro?
We can hear you. Could you please state your full name?
Sure, Joseph Porcaro.
Thank you.
Yeah, I have a couple kids that go to Maria Carrillo, and previous gentleman, a few people ago, he was talking about, he brought up the same point, but I'd like to reaffirm it. It's consideration for students that have had COVID and natural antibodies. And I'm just wondering why it's, why this topic is basically being ignored. It's not discussed. So are there any studies or anything about this? Half of you guys are looking down and one person's behind their chair. I see, Jill McCormick. I guess you're checked out. All right, that's it. So thank you. And
Thank you. Next is Jay Willis. Mr. Willis or Miss Willis, could you please state your name for the record?
Yes, John Willis.
Thank you.
Yeah, thank you very much. I have a couple kids in the Santa Rosa School District, city schools, and I don't see the legal gentleman anymore. I don't know if it was Seth. Right now, my kid, you guys are making suggestions and or considering mandates, and technically don't have a protocol for people that don't adhere to the strict mask policies that you're putting in place. So my child went to school for 3 days in Maria Carrillo High School. The fourth day, he chose not to wear a mask in school, not indoors. Did not want to wear a mask. He was told I had to come pick him up, and he was not allowed back at school, and he's now been forced into independent study. Now, granted, that's a year after being in remote school. These kids are being mentally traumatized. Even at school, they're 6 feet apart. I don't know what congregate the grouping that is if we are doing social distancing. And I've talked to the CDPH. I have talked to Sundari Mace personally. I've talked to the CHSS. I've talked to the principal. She's very sweet, Monica, at Maria Carrillo High School. But we seem to be in this groupthink of protecting our jobs and what's socially acceptable and socially protecting our kids. I see nothing about science here. I see nothing about immunity. Immunity is better than a vaccine. The vaccine's not working. A breakthrough cases for vaccines that don't work. Get out of your groupthink and start protecting kids. Do you guys have children in the school system? What are we doing? We have no science. Mark L. Sundari, where are you? Where's the legal guy? When you are kicking kids out of school with no science behind the mask, there is no transmission reported among young kids, adolescents. I don't care, 18 or 12 years. Keep smiling, Steve. Yeah, you. I see you smiling. This isn't funny. The parents are in control, not you guys. Protect our damn children.
Thank you. Next, we're going to try Stacy Ponce again. Stacy, could you please unmute?
Can you hear me now?
We can, yes.
Okay. So I'm based on the same thing. I don't hear a lot about, well, what we do hear a lot about is what you guys think is best for our kids and not what we think is best for our children.
I'm so sorry, Ms. Ponce, but your sound is fading in and out. I don't know if there's anything you can do about that.
Can you guys hear me?
We hear about half of your sentence.
Okay. Can you hear me now?
Yes.
Okay. So as I was stating is we hear a lot more about what you guys think is best for our children and not what we think is best for our children. In regards to masks outdoors, I would love to see the science that says that they're safer with a mask on. I have talked to numerous parents and heard from school districts that children are being made to wear their mask running the mile in 100-degree weather, and then they're becoming ill. Tell me and show us where that makes them safer than being without their mask outdoors. This is ludicrous. I mean, really, we waste so much time on what you people think. Now, we're grateful that you guys are there to help us, but we are ultimately the ones who knows what's best for our children. And I think it's time that you guys take that into consideration, because you guys are making all these mandates. Have to, or we're going to punish. I've heard some of you say, let's punish them. Are you kidding me? You're going to punish them because they can't breathe? What if they have asthma or anxiety and have a mask on? There are children that have that and physically need to take it off. And yes, I see the shaking of the head, and it is the truth. We would love to see the backing and the science in regards to that. And I would like to have that sent to each one of us parents.
Thank you. Next is Deanna Oliveras. I'm guessing this is Mama Lisha Betting. Is this Deanna?
Yeah, it's me. Can you hear me?
Yes.
I'm just so frustrated. I don't even know what to say. I have so much to say. And it is quite disheartening how there's a few of you board members, and I don't know how many people are on here because you don't allow us to see it. You don't allow us to see whose hands are raised. You don't allow us to see how many are on here. But we have to sit for hours and listen to you all decide, act like you're scientists and parents of our kids, and try to figure out what to do with our kids and our teachers while we're here on computers trying to help our kids with homework, trying to do dinner. I think Lori Fong gets it, but she's not speaking up. Everyone else, I think is lost. I think honestly, Lori, you've been around long enough to know how we're feeling, and I hope you have our back very soon. My faith is telling me that you will speak up for us, but nobody else gets it. We're on the sham for how many hours until Dr. Mace, which I don't even like Dr. Mace normally, gets on and makes you guys look stupid to say you don't have the data. You're on this like high hill thinking your ego is taking over. Simplify it. Parents are pissed. We are pissed. We want to recall you. We want to take your seats. We are furious. I don't think you understand. You are working for us. We work our ass off to put our kids in public schools. We're going to pull our kids. You have to look at us to see what we want. These are our children. Let us decide if they're going to get vaccinated. Let us decide if we want them to mask outside. Let us decide if we want them to get COVID. They are our children.
Thank you. Next is Lisa Mott.
Hello, thank you. Yes, I'm also a parent that stayed on for this many hours to speak. I hope you guys can hear me. Okay. I did want to first confirm that parents will be able to opt out of the intrusive testing, and I don't think that was made clear to us. I think it was highly suggested by your legal advisor that parents do have the right to opt out, and I hope that you will inform parents of their rights. In addition, I just wanted to say that I really appreciated that directors Medina, McCormick, and Fong are suggesting that we continue with the strong recommendation for masking outdoors and keep it that way. As a parent of a high schooler, I drop my child off. I see many, if not, I would say most students already masked outside. My child's vaccinated and wears a mask indoors at school, but she needs that brief time outside to take the mask off. In high schools, we're talking about children that can be vaccinated. We're talking about children that have a lot of demands on them, and they need the opportunity to just bring that mask off their face for just a little bit of time. And actually, the state of California does not require outdoor masking for students. And so I don't feel that we need to do that. And I just want to ask, as a parent who does believe in science and has a child that's vaccinated and has been a parent in the district for over 16 years, when do these measures start to chip away at the mental health and wellness of our school communities? And when do these top-down measures by the board become yet another example of the board's disengagement from what parents are asking for? This is causing a great deal of distrust and fear for parents and students.
I'm sorry that you've reached your time. Next is Sean. Sean, could you please state your full name for the record? Sean, are you there?
Can you hear me now?
Yes, can you state your full name, please?
Yeah, sorry. My name is Sean Wirtz.
Thank you.
I have a couple children that attend Santa Rosa City Schools. We're all very upset about what's going on right now. So I'm going to try to make this as quick as I can. I was a little nervous when I saw a lawyer come up on your guys' screen today. And then all of a sudden you brought on a bunch of doctors. And I thought you're going to lay it on us, but actually they had to rein you in. You guys are so authoritarian. You're trying to figure out the worst way you can restrict our children. So, I mean, Mr. Flores, I know there was other ones too, but you asked about testing our kids when we wouldn't consent. I have an answer for you. California Education Code 49451 says a parent or guardian having control or charge of any child enrolled in the public schools may file annually with the principal of the school in which he is enrolled a statement in writing signed by the parent or guardian stating that he will not consent to a physical examination of his child. You cannot do this. It is against the law. There is also one from the U.S. Department of Education. It's called the Protection of Pupil Rights Amendment. They say you have to offer an opt-out for students. So stop screwing with us and follow the law. Now I'm going to give you guys a little bit of education on the stats for children. 534 deaths since the start of COVID for children. A lot of them had very high comorbidities. How many was it in Sonoma County? 0. The whole time, 0. They're 22.3% of the population, and not even 0.1% of them have died. Thank you.
Thank you. Next is Shelby Dodson.
Hi, we spoke earlier and we were talking about the fact that people are rejecting being vaccinated and mask mandates. I'm a public activist. I've heard these parents tell you and plead with you to give them their rights to go ahead and be able to do with their children as they want. Some of your faculty and employees feel the same way about their personal health. Going ahead and doing this has created shortfalls within your organization and made it to where you are having problems employing people gainfully because they don't trust the fact that you are putting their risk of health in regards to your guys' mandates and the things that you want. There's an old saying that said you can get more flies with honey than you can vinegar. The reason that's so important is you want people to see your side as vaccinated, but I come from an era personally where my parents were both in the know of what was going on in an era when black and white people couldn't be together. That was a law. It was literally something that people would go ahead and shame you for. We're in a position that may not be familiar to some, but probably hits home for many in an era that grew up that way. Our children are now experiencing this. I have a 17-year-old son and I have an 8-year-old daughter. Mandating someone to be vaccinated against their will, though you may think is not illegal, it is immoral. You guys are not accepting people's religious preferences. You're not accepting the fact that people have underlying conditions that may affect them. And these are things you guys need to think about in great detail. Thank you for your time.
Thank you. Next is Veronica Jordan.
Hi, y'all. Thanks for having a meeting that's so long I can go to another meeting and come back. And I want to say thank you for all the hard work that everyone is doing. I know that this is so hard for so many of us. And what I hear in parents' voices is the trauma of the last year and a half and their deep concern for their children. And I know you know that. What I would like to say is the notion of making a problem where there isn't. If school-based transmission is not a problem currently in Santa Rosa City schools, I would just encourage us to focus then our attention where the problems are, and our funding and our minds and our brains and our hearts. And I feel like where those problems are getting our kids re-socialized, getting our kids caught up, getting our kids their math facts, getting our kids feeling safe on campus. And whatever we can do to maximize all of those things is really where we should all be putting our energy. I think we're so lucky to live in a county with a high vaccination rate. We're lucky to live in a county with a high mask adherence rate, and that is going to protect our children. And I hope that we can stop getting distracted by the idea of working on stuff for the theoretical problem and really handle the problem that's in front of us. And the problems I see in my kids' schools and in the patients I see and in the parents I see is that we are all traumatized by this and it's not over yet. And we need to support each other and working through re-socialization. And I really want to direct your attention and please would like to hear more about learning loss because I am really worried, especially about our most vulnerable kids in this district who can't read or can't do math. It's real. It may not be real for the white middle class kids like my own, but it is real for sure. So thanks.
Thank you. Next is Janelle. I'm guessing this is Janelle Payne. Is this Janelle Payne?
It is. I'm still here too. Hello, everybody. So I've got a few things to say. First, I just want to remind you, as you know, that our district leads the way, particularly in Sonoma County and in Santa Rosa. And what we choose to do, it will empower other districts to keep their students safe as well. So I encourage you to continue to be bold in your actions. Regarding several speakers and the, creating problems that aren't there type or solving problems we don't have, the truth is that we don't know the reality of transmission on campus. Students are quarantining or isolating with symptoms and they either can't get a test because they don't have access or they're getting a test but not reporting their results. We have a passive system of data collection and our numbers are not reliable. So we don't know what is happening on our campuses without some sort of screening testing. Regarding parents not having a choice, having agency to decide for their own children, they do have a choice. They can choose to comply with whatever the mandates are of our district, or they can choose to remain or go to independent study. It's the same choice that other districts are offering as well. So it's a misnomer. It's a false narrative that parents don't have a choice in this matter. They do. It's called the social contract, by the way, right? We don't have the right to literally everything. We give up some of our rights to live in a society that is safe, right? They have a choice. Third, maybe fourth, I don't know, hospitalizations in Sonoma County for children 5 to 17 years old have doubled in the last 2 weeks. It's a small number, it's 10, but the percentage increase over the last 2 weeks, the numbers have doubled. And then finally, yesterday, there was a referendum in California. It shows wide support for strong COVID measures. These parents we hear, but they're not the majority. Thank you.
Thank you. And President Fong, everyone who had their hands raised was able to comment during this time period.
Thank you to everyone who stayed to listen and to bring us your thoughts. Just remember, please, that we are listening, and even though we're not going to decide maybe the way you want, we have still heard you, and we are still considering. We're all thinking very deeply about it. We need a motion to extend this meeting. We still have some more meeting to do.
I'll make a motion to extend the meeting to 10:45.
Second.
All right, that was motioned by Jill McCormick and seconded by Ever Flores. All in favor?
Aye.
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 Opposed? 10:45. We are consent item. I think we only are going to, it was E1, is that right? Was the only one that was pulled? Okay, so let's approve E2.
Move to approve item E2.
Second.
Thank you. That was Omar Medina and seconded by, I think, Ed Sheffield.
Director Medina.
Aye.
Director Sheffield.
Aye.
Director Manieri. Aye. Director De La Cruz. Aye. Director McCormick.
Aye.
Director Flores.
Aye.
President Fong.
Aye, thank you. All right, so we had the public pull this, and I think 4 people asked to pull this, and we also were going to talk about it as board. So let's have the presentation. Let's do questions. Then let's do public comment. Then we'll do discussion.
On the consent item, do we do presentation or is it just the comments?
True.
Yeah.
Let's pull it up
Correct.
so we can take a look at it.
Thank you. So what we brought forward to you tonight, President Fong, members of the board, and the public, is an agreed upon MOU between SRCS and SRTA that is based on their desire to bargain the working conditions under the return to school guidelines, and specifically safety measures, as well as compensation and other factors. And I will pause here to see if Assistant Superintendent Shepherd would like to give any other detail to the MOU before we hand it back to the board.
Just to say that this was a collaborative process. It did take some time, but we worked very well together, and we can entertain any questions that you may have.
All right, board, go ahead and raise your hands. I'll take a look at who's got their hand up. We'll start with Director De La Cruz.
Thank you. So I appreciate Superintendent Turnell, the explanation around the right that unionized employees have to bargain over the conditions of their work. And I also remember us, this board, talking about that there wasn't a need for an MOU for this coming year. And I know that times have changed. Delta and Mu and other variants have extended this time. So I'm just wondering if you could speak to kind of the changing circumstance in front of us that resulted in a need for an MOU despite our assurances last year that there was no need.
Certainly, and I recall those conversations, and I believe I may have articulated in various spaces that we didn't anticipate. There was also mention, and I don't want to speak for SRTA. I know that Ms. Howell is present tonight, as well as other representatives, but there was discussion about the potential of not needing to have an MOU. When we started the school year, the board approved the board policy 0470, which was to allow for mitigation of the pandemic. And under that assurance, there was understanding that we would not have to, or we would not need to continue with MOUs. However, a bargaining unit or a labor group has the right to request a bargain working conditions. And that is the request that we received, and we went as partners to the table to work through those. And so that is why we're bringing forward this MOU, again, as Assistant Superintendent Shepherd mentioned, in partnership and collaboration, working with us SRTA through those working conditions so that they are memorialized, if you will, in an MOU, which then provides their members at their request assurances to particular guidelines and other factors that the district would follow for the membership.
So if I'm understanding correctly, even though we have a collective bargaining agreement in place that governs the working conditions of unionized employees and kind of sets the, the rules of engagement, an MOU is the mechanism by which we are making changes to that CBA, or we're adding additional agreements given changing work conditions as a result of the ongoing pandemic.
So the CBA still stands. When we are experiencing something like what we are right now, where we have changes in working conditions because of mitigations, such as masking, for example, such as other protocols that are called for, a labor group has the right to request to bargain around those working conditions. It goes in tandem with the bargaining agreement. It does not trump it per se. The bargaining agreement still stands.
So my last question for right now is, we've had an extensive conversation tonight around board policy that may change foundation under, that the MOU sits on. So I'm just wondering, kind of timing moving forward, is there a need for us to set board policy prior to agreeing to this MOU or approving this MOU? Like, I'd like to understand a little bit more about the kind of the interplay between board policy on masking mandates, on vaccine mandates, et cetera, and how that impacts this agreement before us. It feels a little chicken before the egg. And so I just want to get some clarity on timing.
Thank you for that. And Mike or Mr. Shepherd, feel free to weigh in as well. But as we have several moving parts to this process, we have this MOU, which speaks specifically to how members of a particular labor group, right, will have assurances. We also have our COVID safety plan, which your recommendations tonight will also filter into that revised document that we will ask for action next week. Board policy and the COVID mitigation piece is really at a higher level. And we certainly would want to take a look at any of our board policies in terms of if there are new conditions that would change sort of in perpetuity versus maybe looking at our board policy for minute details that we might actually want to extract so that we are not having to rewrite policy all the time, but that it covers a broader sense of what we mean by how we protect and how we ensure how we move forward in our work.
And Superintendent Trinnell, if I could add in, what triggered this MOU was also changing guidelines from the state in July. So, and as you well know, board members, you set policy, you decide the direction, and that's your purview. And the bargaining units under the Equal Employment Relations Act actually have an obligation to represent their members. And so it's their duty to call into question any perceived or real or otherwise changes to their working conditions. And so we're required to enter into those conversations to discuss the impacts and effects of your decisions or decisions handed down to us by the state or county. And so that's, any decisions that you make may trigger a need for us to come back to the table and continue discussions.
Thanks. I have a few other questions, but I can probably raise them in comments towards the end of our discussion.
I'm going to call on Director Sheffield.
Thank you. I'm in full support of employees bargaining their working conditions. Definitely in these times, conditions change and have changed throughout the pandemic. I just question this item being on consent. This is definitely an area we want to have some discussion, and having it on consent. I just don't want this to set some type of precedence. That's all.
And may I respond, President Fong?
Yes, please do.
We've actually set precedent, Director Sheffield. For the past few years, we've put the MOUs on consent. And so we were simply following suit.
I understand that. Yeah, I'm just, moving forward, especially on something that had this much weight going, last year, and a lot of discussion that it generated throughout. I get that we've done it in the past, but this is, it has a little bit more weight to it, something that we should consider. And as I said, I'm in full support of our employees bargaining right now. Absolutely. It's their health. These are valid concerns. Just would like to see it. I would like to see it on the regular agenda.
Noted. Thank you.
I have a clarifying question that was raised by somebody. If we're looking at item 9, there's some conflicting language here. On 9A2, we're talking about you come back after other symptoms have improved. This is what the CDC is saying. And then further down, we say, after, look at B, we're looking at 9B at this point. We're saying after the symptoms have stopped. So there's a little difference that I'm unclear on.
Is Mr. Mazzara still on the call? I don't see him.
He's still there.
I see him as a participant. Can we move him back over?
So I guess the question is, do kids come back after their symptoms have stopped or after their symptoms have improved?
That's a good question. I'd like Mr. Mazzara to weigh in.
Thank you. Thank you, President Fong. I think I heard that as I was coming over. Our students asked to, was it stop or improve? Is that the?
Right, so CDC, yeah.
There were some discrepancy that we thought we cleaned up. We may have missed that. It's stopped. It's not. CDC had one language from the spring, and one of the conditions that they thought they'd clarify is that you can't have any symptoms, not just improving. There was a 100.4 fever, and there was some thought that if it's 98, you could still come, and then they clarified that and said no. So I think that.
What if, like coughing? Kids are still coughing.
Yeah, no, you do not come with any symptoms. Pretty clear, black and white.
So that has to be cleaned up then, right? That piece?
Mm-hmm. Agreed.
Thank you. And then if we take a look at 5C. The second sentence in 5C about physical distancing says that in the MOU, unit members will not be required to be indoors with unmasked students while the students are eating. So who will be inside with kids?
Assistant Superintendent Shepherd, can you speak about the duty-free lunch?
Yeah, primarily teachers have a duty-free lunch that coincides with students' lunch. So this is not really an issue. The discussion was more around the nutrition break for elementary or recess, and they're also not present during that time. There was just a strong fear that they may be required to be in a room with students unmasked and eating. So we think that this was a concern that we could address through this language.
Yes, duty-free lunch. So I understand that maybe this is a moot point because they're already not with kids during lunch.
Correct.
All right, thank you. No other questions? Let's take the public comment.
So President Fong, there were 4 members of the public who asked to speak on this earlier in the meeting. John Navarro, Sheila Walker, Stacia Okura, and Deanna Oliveras. And if any of these 4 members of the public would still like to speak on this, please raise your hand at this time. And I believe those are the only 4 public comments we'll take, President Fong.
That's correct.
Okay. Stacia Okura.
Good evening, everyone, again. I've just had a chance to review the MOU, and I understand that you may have needed some modifications to the contract to cover conditions around makeup work, etc. But I'm really disappointed that the district made no mention that there was a new MOU in play before this week. Really wanting the district to be a lot more transparent with parents and the public to know what's going on, what's being negotiated. It should have been mentioned at, multiple prior board meetings. A new MOU for this year was a really big concern of mine because last year the district did not renegotiate the MOU for the entire school year, which meant that we were tied to safety measures that were out of date and no longer reflected public health orders. And I know that the intention is for this to be a living document, but that was the case for last year's MOU and it was not a living document. So I feel like we're in deja vu and we're reliving in MOU land. And so this new fully signed MOU that you're asking the board to sign tonight, it lasts through July 22nd. And it locks the district into safety guidelines, even though public health policy is not static. Even safety guidelines that tonight the board is discussing and hasn't voted on, such as number 10, which allows staff to test instead of getting vaccinated. You're asking the board to approve a document that's already out of date. And so I guess my question is, why didn't the district do what you had said a few months ago and establish a district policy that could be continually updated to match CDPH and Sonoma County Department of Public Health recommendations and orders, instead of memorializing specific guidelines and recommendations in the MOU that really aren't working, that we know will change, like having a strong recommendation for outdoor masking memorialized in the MOU, which based on the discussion tonight might also change.
Ms. Okura, you've reached the 2-minute time limit. Thank you for your comment. Next is Sheila Walker.
Hi, good evening again. It's been a long Wednesday night. President Fong, Superintendent Trunell, and members of the board. I would suggest that the board remove this consent item altogether. Why can't you as a board do as you told us you would do a few months ago and abide by current CDPH and Sonoma County Health Department policies. Why would the district supersede the CDPH and Sonoma County Department of Public Health policies? I am concerned by the language in the MOU. I know I don't have much time, so here is a quick rundown. Why would a labor partner or the district want to change language from the CDPH? Why do we need to? Why are we again making something very complicated and difficult when we have stated in the current MOU that we will follow the guidelines set forth by the California Department of Public Health and the Sonoma County Public Health Office? Changing language that can keep students out of the classroom longer than necessary is not okay. It is not okay. Please pull this item from consent and revise the language with an emphasis on keeping kids in school versus potential additional learning loss. If you pass this item and it lasts all the way through July, what if guidance from CDPH or the county differs? Who knows? Maybe COVID goes away in 2 months. What if, just as this summer, masks are no longer required at the state, from the state level on down to Sonoma County and our district? We will be locked in to whatever you're deciding now with our labor partners. Finally, I can't see the clock. You know, COVID is ever changing. Please follow the public health policy guidelines. Do not lock the district, our children, and all of us into policies that will be difficult to change when health measures change. I was stunned to see the MOU includes that union members will not be required to be indoors with unmasked students during lunch. I mean, shocked. These are our teachers.
Ms. Walker, your time did run out a while ago. Thank you for your comment. Next is Deanna Oliveras.
Exactly what Sheila said. Pull this as a consent item. This meeting was supposed to be for COVID-19 updates for parents, for input. But instead, what happens? The teachers union gets to slide in an MOU. As everyone's looking at their phones right now, go ahead and put that MOU through and see what happens. We will pull our kids out. Some parents don't have enough time because they have 1 or 2 jobs to realize what they're asking for. They're asking for physical distancing, which last year the MOU asked for 6 feet distancing before the state even asked us for 3-foot distancing. And we were stuck at 6-foot distancing for the whole year. This teachers union is asking for more than the county, the state, and federal guidelines. It's ridiculous. You all should be advocating for us, but you're not. They're asking for extra protocols. They're asking for an extra 10 days of leave in case one of our nasty little children's happen to get them sick. They're asking for extra vaccinated and unvaccinated quarantine and modified quarantine. They're asking for extra pay if they happen to have a student who's out for 3 days, whether they're waiting for a COVID test or if they do have COVID, they want extra pay for putting together a packet of work for our children. Our taxpayer dollars are paying their salary. Parents don't get an MOU. Kids don't get an MOU. You're going above our heads and you're negotiating with these people that are politically ran. You should be going to the ground and asking us how we feel. Those are our children, not yours.
Thank you. And the last comment is John Navarro.
Hello, board. Thank you for letting me speak. We went through the same thing last, January, when you guys passed an MOU by consent and then left, even though I have a pretty strong feeling that many people knew the guidance would be changing in just a matter of days. That locked us into not being able to educate as many kids as we could that year. A lot of kids were held out of school. You know, kids in high school only got 10 half days because of that MOU. And now you guys are doing the same thing again. It's not right. You guys know it's not right. please don't codify health language in an MOU. Thank you.
Thank you. And President Fong, those were our 4 people who had asked to comment on this.
Board, this is open for discussion before we vote.
Move to approve the MOU as presented.
Second.
I have some serious concerns about the fact that the MOU would already be out of date based on our conversation today around some of the mandates. So I'm really hoping that that can be addressed. I don't see this as a living document. It feels very directive around specific ways of engaging with teachers and the district. And so I'm hoping somebody can point me to the language in the MOU that allows for that flexibility.
I'm going to tag on that. With things rapidly changing, and in fact, we're changing things tonight, and we haven't even voted on the COVID protocols for safety until next week. I don't know how we change this. We're going to have to change this MOU. So it seems to me that we could table it and take it up with changes, because I think I would have to agree until July 22nd, if we're locked into something and things are changing and we know things are changing. How do we use that? How do we do that? I don't know how we do that.
For President Fong, is this the opportunity where I could speak to that?
Yes, because I see nobody else's hand except for maybe I see Mr. Medina's hand.
I can wait.
I just wanted to ask for further clarification on what Director De La Cruz was referring to. Is it the, let's see, I think there's number 10 where it says all units will provide proof of being fully vaccinated. Like if we went that route, is it that part or is there some other part of the MOU that's the concern? I just kind of want to be on the same page as to what the concern is.
Yeah, no, I'm reflecting, I think, what I heard, specifically from Dr. Navarro around the kind of why are we codifying language that comes from other agencies, not ours, that we don't have control over how they change, that may lock us up in what we're able to do if we are following those directions because we've agreed to something that cements what exists now until the end of the year. So I don't see language in the MOU, for example, that would say current, at the time of adoption, including any future changes, right? Like that's the kind of language in an MOU that would allow for that flexibility to track changes in CDPH and CDC guidelines. And I don't see that language in this MOU. And so there's also there's links to CDC guidelines that could change, but we don't know if the link to the page that says, here's how the CDC says to stay home when you're sick now, right? That page could totally change and our link would no longer apply. So we've put some very kind of specific and directive forms of guidance that comes from way outside of us and what we can control into this MOU and made it last until the end of the year. So I'm just, I don't understand how we could do that now, especially after the conversation that we just had.
Superintendent Trunnell.
I wasn't sure if Director Medina wanted to add additional commentary.
I did. I just kind of wanted to try just kind of how I understood everything. And to me, when I read like item 2, it's the CDPH stuff was used as kind of the guiding document. It's kind of how I understood it. And the public health guidance, it specifically mentions the one from August 2nd, right? So in terms of this agreement. So I think if stuff were changing in the future, this agreement refers to that specific item. And I think all the items from those are outlined within here. For example, and I think it was like the 9.2 or whatever section. So I'm just curious if the concern is that things get more strict or things get less strict, or just the lack of flexibility in terms of because I think things are constantly going to be changing, and if they're constantly going to be changing, are we going to constantly be doing these MOUs that we know take a long time to negotiate and deal with? So then I'm just curious, do we not do one when at the same time we know we need to work with like our teachers to make sure that everybody's on the same page in terms of what we do? So I guess I'm trying to figure out what it is that we're trying to get at.
Right. So again, my recommendation would be, if we are agreeing with our, and respecting those labor rights, which I think we are, and in reaching an MOU, then typically what you would do is provide some flexibility in the language of the MOU that would contemplate changing guidelines, and that would allow for, not for the guidelines that were adopted on August 2nd and no others that may follow after August 2nd, right? You would say, beginning with the guidelines adopted on August 2nd and those which may follow, right? Like, you're allowing to build that in. And then I think, again, to track the concerns around language that is conflicting with current federal guidelines versus past federal guidelines, like we shouldn't be trying to replicate federal guideline language in the MOU. We should just be reflecting what the federal guideline is out there and say, we're reflecting it, but we're not saying what it is in our own words, or trying to capture some older version that then conflicts with the newer version, which is right. So I guess that's my concern. I understand that the MOU is the kind of preferred vehicle for memorializing those agreements. But if our agreements are to follow the guidelines of other agencies, except for those which are, I think what we've talked about tonight, right, are some of the ways in which we're actually going to go, we're contemplating going above those guidelines. And so I guess those are that's the two, there's now two challenges to this MOU, right? Is one, that it's stuck in guidelines at one time in history, and two, it doesn't actually contemplate allowing the board to go above those existing guidelines.
I see Ever's hand up and I see Ed's hand up, but I would like to hear from Superintendent Trunell.
Thank you. And I certainly look forward to hearing those comments as well. A few things that, just to respond to what I've heard. One, I want to acknowledge that SRTA did not force this item onto the board agenda this evening. That was a decision that I made, that we as a district leadership made, knowing that we were having a full discussion tonight around COVID. So I just want to acknowledge that first. It is the district's decision when we bring these items forward. Secondly, number 2 and 3 in the MOU have been our standard procedure over several MOUs between both of our labor groups. That is the caveat and sort of catch-all to how we move forward. Specifically in number 3, the parties agree to meet as soon as possible to negotiate the impact and effects of any revisions or updates to those guidelines. And so we've actually done so in previous months where we didn't have to bring formal MOUs forward again, but we agreed to just the changes in those practices. It does take time. It's better to be on the same page with our labor groups than to have dissension. And so, I just want to call those out. Also, number 10, I think, was one of the items mentioned. Much of the language in here is the minimum. It is what the county and or state is currently recommending. So anything that you choose as a board to recommend above that would still stand. We certainly would then certainly have conversations with both of our labor groups about how that affects their working conditions. And we would continue to move forward. And that is actually the typical life that we live in, constantly collaborating with our labor groups. It is not a one and done. It is a living process because we are working with people, and we know that everything that we do affects how we serve students, how we serve our staff, how we serve our families. And so we always work from that lens.
Thank you. I'm keeping my eye on the clock. And so Director Sheffield, Flores, and Manier each get 2 minutes.
Thank you, Superintendent Janelle, that you highlighted some of the areas and language that stood out for me. I also want to point out language that reads that attached is the articulation of a version, not a binding document. It shall not be used as a directive to unit members to work beyond the scope defined within the San Jose. I mean, this is great language because, again, it is, I mean, to me, and maybe to answer some of your concerns, Director De La Cruz, it is spelling it out. I don't know, maybe we need to spell it out in even stronger language, but I'm seeing it spelled out. I'm convinced that this document is not written in stone, in a sense that it is holding us to something that is not reasonable or rational. And again, as I read through it and I reread through it, and I was looking for language to tell me otherwise, but I just didn't see it. So perhaps there's a way that we can, we can, I don't know, strengthen language. I don't know, but I see what you're getting at. I see your point, but I was looking for more. Maybe I was looking for language that would sway me the other way, but I just wasn't seeing it. I'm convinced that this document is, and has, the intention to not be. Sorry, it's late. It's has the intention to
And
not be.
wrap it up. I'm going to call on Everett Flores right now. Sorry.
Thank you, and thank you, Superintendent Anna Turnell. I was going to mention item number 3. Thank you for bringing that up. It gives this document the malleable sort of terms that it's needed in terms for negotiations in the future, and that's all I was going to say. Thank you for bringing that up.
Director Manier.
Yeah, I appreciate pointing out number 3. And I guess my question is, because I am no legal expert, and so I guess my question is either to Director De La Cruz or to staff, is that strong enough language for the kind of flexibility that Director De La Cruz and some of our public commenters talked about?
I can speak to our practice. We meet with our labor groups weekly. And so, we have the ability to have discussions in a flexible way when things come up. We're also monitoring the outcomes of these MOUs and ensuring that if something is not working, that we are coming back and having conversations about how to make that right. And so we have data, around that as we're having those discussions. So I always see these as flexible because conditions are always changing.
And and I don't know if there is, but what's the typical turnaround time in making those kinds of revisions to an MOU like this?
I think it depends on, what it is. It could be within a week. The thing that we have to remember is, when a labor group needs to ask their members for ratification, that takes on a separate life and timeline. And so, for example, the ratification process for this document will not wrap up, I believe, Assistant Superintendent Shepherd, next Tuesday.
Yes.
Right.
correct.
And it's actually a different process for CSEA as well. So everything that we do, and so for example, I'm just going to throw it out there. If there was something in this document that the board was adamant did not exist, then what would happen next is we would have to hold negotiations. The changing of the language would not happen in the midst of a board meeting. The changing of the language would take us back to the table for however long that took for us to come to a new tentative agreement around the new language. And then we would bring that again forward to the board for consideration.
Thank you. I appreciate all that clarification. And the last thing I just kind of want to add to the discussion piece of all this is that the conversation that we're having and what's being said about, the language in this MOU, it's also, and it's this is being recorded, it's on record. So, I mean, this is also to help our parents and our community hold us accountable to what we said. And I appreciate those who came back and reminded us of the barriers that we've experienced in the past. And I'm hoping that this discussion will also serve as a tool for accountability in the future.
I am going to hold us to number 3, that second sentence. And I just want to reflect quickly on the difficulties we had this past spring. And I felt that I had to uphold our teachers, our staff, and protect them and respect the MOU that they had, yet also listen to our parents who were just so upset where they felt that it was the MOU that was keeping us from going back to school, when that was debatable. The parents thought one way, we thought another way, labor thought a different way. I want to make sure that we are continually responsive for our children, to our labor partners, and to our parents. So I'm really going to depend on that line in number 3, that when things change, we will go back there. And that's good enough for me right there. The parties agree to meet as soon as possible to negotiate the impact and effects of any revisions or updates to these guidelines. All right.
President Fong, I'm sorry, and just since for the record, I do want to apologize. My quote I took out of the other MOU. I had them both open, and so I just want to correct my mistake. I did read incorrectly from the wrong MOU.
All right, so we have a vote before us.
That I just for the record, that language that Director Sheffield quoted was in the last MOU and not in this one.
Correct.
Adina, can we have that vote, please?
I'm sorry, President Fong, can you repeat the call in the second?
It was motioned by Omar Medina and seconded by who? Clerk Flores.
Okay, thank you. Director Medina. I couldn't hear you.
I didn't hear you.
I said aye.
Director Flores.
Aye.
Director Manieri.
No.
Director De La Cruz.
No.
Director Sheffield.
Aye.
Director McCormick.
Aye.
President Fong.
Aye. All right, that passes. And Superintendent Trunell, any last comments?
I just want to recognize, this is certainly a challenging time for everyone. We continue to keep students as our center. I've heard our parents tonight. I want them to know that we are preparing to gain their feedback as well. We do not see them as not a part of this equation. Yes, we are serving your children. I want to respect everyone who's stuck with us tonight. I want to thank this board and the members of cabinet and this team who have continuously worked to ensure that we are, keeping students at the center of our work, and appreciate the partnerships with our labor groups as well as we do this work. Again, a shout out to the many guests that we had with us tonight, who stayed longer than I initially thought, and I was very grateful that they were. So thank you, President Fong.
And with that, thank you, Superintendent Trunell, and we are adjourned. Good night.
Good night.